vaccine efficacy. This is often referred to as an immune correlate. And this is a paper recently published in a preprint server. And what it shows is that a model of vaccine efficacy, in this case, based on the Moderna phase 3 trial, showed that 4 weeks after the second dose, that what you have is a serum neutralization titer of 1 to 100, which goes up from the vertical red line. That gives you an efficacy of 91%. But if you look at the dark black line going from left to right, as you go further up, you get a higher degree of efficacy. So the higher the neutralization titer, the higher degree of efficacy of the vaccine in this model. Next slide. Third issue, higher levels of antibody may be required to protect against Delta. And I'm showing you data now, both from Moderna on the left and a paper in the New England Journal has very similar data from Pfizer. So if you look at the left panel, what you're measuring is neutralization titer after 2 doses of the immunization. And the open circles are the same people as in the pink circles. And you're looking at the fact that the neutralization titer required to neutralize the standard prototype D614G, which was the original variant, is clearly the titer is much lower. As you see, it all goes down in pink when you're dealing with Delta. Next slide. The next concept, and that gets to the booster. The booster mRNA immunization increases antibody titers by at least tenfold. These are data from Moderna, but Pfizer has announced very similar data. The bottom line is, if you look first at the left panel, the first column is looking at the antibody titers just before the third dose. And then 15 days after the third dose is shown right next to it that says D15. As you can see, a remarkable increase in titers against the 614G, the B1351, the P1, and in the Pfizer data, which you expect would be very, very similar to the Moderna, it was also against the Delta variant. So you get a dramatic increase in antibody titers when you do a third immunization dose. Last slide. And so in summary, the current immunological data that indicate that antibody levels decline over time, higher levels of antibody are associated with a higher level of efficacy, higher levels of antibody may be required to protect against Delta, and as I showed you on this former slide, a booster mRNA immunization increases antibody titers by multiple fold. All of this support the use of a third booster mRNA immunization to increase the overall level of protection. We'll go back to you now, Jeff.
Thank you, Drs. Murphy, Fauci, and Walensky. I want to be clear, the president's whole of government vaccination effort is ready to get every American who needs one a booster shot. Pending FDA and ACIP approvals, boosters will be available starting the week of September 20th. The plan is for the rule to be simple. Get your booster shot 8 months after you got your second shot, I apologize. So if you got your second shot on February 1st, you can get a booster starting on October 1st. If you got your second shot on March 12th, you can get your booster starting on November 12th, and so on. Thanks to the aggressive actions we have taken to establish our vaccination program, it will be just as easy and convenient to get a booster shot as it is to get a first shot today. We have enough vaccine supply for every American. And you'll be able to get a booster at roughly 80,000 places across the country, including over 40,000 local pharmacies. In fact, 90% of Americans have a vaccine site within 5 miles of where they live. And importantly, boosters will be free, regardless of immigration or health insurance status. No ID or insurance required. So the bottom line is that we are prepared for boosters and we will hit the ground running. In the weeks ahead, we'll continue working closely with states, healthcare providers, pharmacies, and national and community-based organizations to ensure Americans know they should get a booster shot 8 months after their second shot. And we will be laser focused on getting boosters to long-term care facilities to make sure residents and staff get their shots and are safe and protected. Importantly, as we continue to vaccinate Americans, we will maintain our focus abroad, as we know this virus knows no borders. We have already shipped more than 115 million vaccine doses to 80 different countries. More vaccine doses donated than all the other countries in the world combined. And just this week, we started shipping the 500 million Pfizer doses that the US pledged to purchase and donate to 100 low and lower middle income countries in need. And in the coming weeks and months, we will do even more to lead the global vaccination efforts, accelerating our work to build vaccine manufacturing and production capacity, both here in the US and in other countries. Our wartime effort will continue doing everything we can to get even more people vaccinated, both here at home and around the world. We can and must do both at the same time, because that's what it's going to take to end this pandemic. And we will not stop until we get the job done. With that, let's open it up for questions.
Thanks, Jeff. And as a reminder, please keep your question to one question. There are many today. First, let's go to Lev Thatcher at Stat News.
Hi, folks. Thanks as always for doing the briefing. This is a Mike Ryan quote from a WHO briefing earlier today about booster shots. If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets. And I'm curious, I know you've emphasized, all of you, that this is a false choice, vaccinating Americans versus vaccinating the rest of the world, but could you explain how there isn't finite vaccine capacity and how booster shots for Americans does not at this moment come at the expense of first vaccine or second vaccine doses for folks elsewhere in the world?
So let me go first, and then Dr. Murthy, if you want to add anything. Look, to end this pandemic, we have to protect the American people, and we have to continue to do more and more to vaccinate the world. Both are critical, and we're already proving that we can protect our own people here at home as we help others. Just to give you some data here, in the months of June and July, the US administered 50 million shots here in the United States, and we shipped more than 100 million to other countries. As I said, the 115 million doses that we've already donated is more than all the other countries combined. And during the coming months, when we talk about booster shots, we expect to give about 100 million boosters in the United States. And at the same time, we will be donating more than 200 million, twice that number, additional doses to other countries, on our way to donating more than 600 million vaccines. So we are continuing to serve, as the president has said, as an arsenal for vaccines for the world. And you'll see us do more and more. This builds on our support of the TRIPS waiver, our commitment to COVAX, where we are the largest contributor, of the Quad partnership, which we helped to establish, which is on track to produce at least 1 billion doses of COVID vaccine in India, for the Asia region by the end of 2022, and our work to support vaccine manufacturing in Africa by providing financing to a South African business to bolster manufacturing capacity to produce more than 500 million doses. And we're just going to keep going and going and going. So this is a situation where we're going to do both. We're going to both protect the American people, and we're going to do more and more to help vaccinate the world. Dr. Murphy?
Well, thanks, Jeff. And Lev, good to hear your question. Appreciate it. Look, I do not accept the idea that we have to choose between America and the world. We clearly see our responsibility to both, and that we've got to do everything we can to protect people here at home while recognizing that tamping down the pandemic across the world and getting people vaccinated is going to be key to preventing the rise of future variants. We know that, we see that clearly, and we believe we have to work on both fronts as we have been. But Lev, when we see data that is giving us essentially indications that protection is starting to diminish in terms of mild, moderate disease, when we recognize that if this trajectory continues, that people who are well protected today may see more vulnerability in the future, we have to act. The science tells us that, our clinical judgment tells us that, and that was a collective decision of the top public health and medical experts in this administration. So again, we will do everything possible to protect people in our country. That's why we're announcing this booster plan. But we will also continue to accelerate our efforts to vaccinate the rest of the world. We take that responsibility very seriously.
Next question, please.
Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. How realistic is that September 20th launch date, given that we haven't seen the official EUA request from Pfizer or Moderna yet?
That is the date that we're working toward. And as we've said, that is obviously pending both the FDA's approval and the ACIP's recommendation. So that is the date that we are prepared for the beginning of the week of September 20th.
Jeremy, CNN.
Hey there, thanks for taking my question. First of all, why did you guys decide not to limit this to older and more at-risk Americans and simply say that all vaccinated people will need a booster shot after 8 months? And secondly, you say in this statement that the protection against severe disease, hospitalization, and death could diminish. How certain are you about that? And are you saying over time that you do not believe these vaccines will continue to be highly effective at preventing hospitalization and death? Thanks.
Let's start with you, Dr. Murphy.
Well, thanks, Jeremy, for that question. Look, first I would say that when we look at the data, we see a reduction in protection against mild to moderate disease across age groups. And that was an important part of why we made this recommendation for all adults. We want to protect all adults in our country from the worst effects of COVID-19. But our plan does prioritize the most vulnerable. If you look at how we began vaccinating people, Jeremy, over at the beginning of the vaccination effort, we prioritized healthcare workers, long-term care facility residents, and the elderly. And those are exactly the same populations that we will be starting with. So we do prioritize the most vulnerable. We think that's going to be essential, in our goal to ultimately to protect the country and save the most lives.
Next question.
Alice Park at Time.
Yes, just wanted to ask again, Jeff, if you could just provide some more details on the plan for administering the booster shots. You're going to have to reach the same number of people as in the current campaign, and yet many of the federal mass vaccination sites have closed. So does that mean we can expect to see more doses shipped to doctors' offices, pharmacies, smaller clinics, and will states continue to be the intermediary for managing that and distributing that? And secondly, for Dr. Fauci, can you tell us, you focused a lot on the data looking at antibody responses to vaccines. Can you tell us what we've learned about the T cell response and what role that plays in any decision to recommend boosters or, continue to recommend boosters in the next year or even years to come?
So the first question, there are 80,000 sites across the country, as I mentioned, 90% of Americans live within 5 miles of a site. The booster will be administered at the 8-month mark, beginning at the 8-month mark. We're going to be working very closely, as we have throughout, with governors and local state officials to make sure that we have the number of places for people to get vaccinated in a convenient way, enough vaccinators in the field. FEMA stands ready to help in any way. As I mentioned, that reimbursement's been extended, 100% reimbursement. So we will make sure that it is convenient and easy for all Americans to get their free vaccine, their booster shot at or around their 8-month mark. Over to you, Dr. Fauci.
Yeah, thank you for that question, Alice. There, no doubt T cells will play a role, very likely in not preventing initial infection, but in the progression of disease in the situation that T cells usually do in eliminating or blocking against infected cells. The issue is that they are not as easy at all to measure in the standpoint of large volumes of cohorts. And we will continue to study the T cell response. But the important slide that I showed was the correlate of protection slide, where you showed there no doubt was an increase in protection of the antibody as you got the titer higher and higher. So based on that, that would be the most easily and actually most common and very likely the most appropriate measurement of a correlate of immunity. And for that reason, that was one of the issues that swayed us towards the relationship between titer of antibody and linking that to the next to last slide, where I showed you could dramatically increase the titer of antibody by a boost that is at the 3rd boost months later. And if you looked at that, the increase was really rather substantial. But again, not to downplay the ultimate potential importance of T cells, but if you look at the relationship between antibody titer and vaccine efficacy, it looks pretty good.
Next question, please.
Ouija at CBS.
Hi, thanks so much for taking my question. If it sounds like effectiveness begins to wane sooner than 8 months, and please correct me if I'm wrong. So if the supply is not an issue, can you walk us through the science of how you landed on 8 months, please? Thanks.
Why don't we start with you, Dr. Murthy, and then Dr. Walensky or Dr. Fauci, if you have anything to add.
Sure. So thank you, Wei-Jie, for that question. So let me talk you through how we were looking at this. We did see that around the 6-month mark in the data, you start to see increases in mild to moderate infection. But we know that the most important purpose of the vaccine is to keep us out of the hospital and to save our life. It's to prevent against hospitalizations and death. And fortunately, we are seeing that still holding at a high level, which is good news. But our anticipation is that if the trajectory that we are seeing continues, that we will likely see in the future a increase in breakthrough hospitalizations and breakthrough deaths. And that's why we used our judgment, Wei-Jie, to see to make a determination of when that point may be. And that's how we came to the 8-month mark. I want to be clear, though, there's nothing magical about this number. Could it have been 1 week earlier, 1 week later? This is where judgment comes in. And it's why we put so much time and thought into this decision, why we pulled the best public health and medical minds from together around the department to look at the data, to discuss it a number of times, and then ultimately to come to that determination. And lastly, let me just say this, Wei-Jie. We have said over the last several months that we are looking at the data closely, and when we see a signal, that we will let the public know and tell them what our plan is. And that's exactly what we're doing today. We put the best minds together in administration. We looked at the best data that we had. We saw a signal. And now we are sharing our assessment with the public with a plan for how to make sure that the protection people still have today from the vaccine will continue in the future.
And maybe if I might, Jeff, just add, another piece of data that we've been looking at is our international colleagues who are ahead of us, both in the Delta surge, as well as have vaccinated a few weeks ahead of us in terms of large portions of their population that have been vaccinated. And data we've seen from our international colleagues, specifically and especially Israel, have demonstrated a worsening of infections amongst vaccinated people over time. And so we remain concerned about that as we see in the context of Delta variant, some breakthroughs that are occurring and decreased vaccine effectiveness that is occurring in the context of infection. We are watching other countries, the experience of other countries carefully, and concerned that we too will see what Israel is seeing, which is worsening infections over time.
Yeah, and Jeff, one other thing, it has been such a almost reproducible phenomenon with COVID-19. If you wait for something bad to happen before you respond to it, you find you're considerably behind your real full capability of being response. So as Vivek said in the introduction, you want to stay ahead of the virus. And if you look at the indications that we've had, including with what Dr. Walensky just mentioned, you don't want to find yourself behind playing catch up. Better stay ahead of it than chasing after it.
Next question, please.
Felicia Schwartz at the Wall Street Journal.
Hi, thanks. What will it mean to be fully vaccinated once people are eligible for boosters? Will it be 3 shots or 2 shots?
Dr. Murphy?
Well, so on that question right now, I think what's very important for people to know is that if you've gotten both shots of your mRNA vaccine, you are fully vaccinated right now. You have a high degree of protection against the worst outcomes of COVID-19. But our recommendation, and down the line, again, pending the advice and the review of the FDA and ACIP, the Advisory Committee on Immunization Practices, is that we believe that third dose will ultimately be needed to provide the fullest and continual extent of protection that we think people need from the virus.
Next question.
Josh Wingrove, Bloomberg.
Hi there. Dr. Walensky, you addressed this earlier a little bit, but I'd like you to expand on what has changed. I mean, 5 days ago, with the decision on immunocompromised people, for whom this is a pretty different scenario. Those are people who didn't have great protection in the first place, as opposed to having waning protection. You made a point of saying repeatedly that booster shots weren't needed for the time. And now 5 days later, not only are they being announced, but they're being announced for everyone. Is it the Israeli data in particular that changed your mind? Why the change of position over 5 days? And can you also clarify, Dr. Murthy said this is only adults. Pfizer was EUA'd for 16 plus in December, so we're not that far away from 16 and 17-year-olds being eligible. Should they get a booster when they are at 8 months, or should they not get a booster when they are at 8 months? Thank you.
Thank you, Josh, and thanks for actually noting that clarification. So we made, based on the FDA review and ACIP, and exactly as you said, the note that immunocompromised people actually never got really a good immune protection to begin with. We noted that as of now, we should be offering a third dose of vaccine to our immunocompromised people, anyone immunocompromised who's eligible for vaccination. However, what we've seen over the data that really has been analyzed over the last week or two from data through July, because it was important to really understand the impact of the Delta variant here, we are starting to see waning immunity with regard to symptomatic infection, not severe infection, but symptomatic infection. So we're staying ahead of this virus. And what we are saying is we are planning for a time in, September 20th to say, as we are following symptomatic infection is waning, we have not yet seen that severe disease and hospitalizations is really waning. That's remaining relatively stable, but we're looking at other countries. And as we do so, we're seeing worsening outcomes in other countries. And in the context of all of these studies, different cohorts, different settings across the country and our international colleagues, we've made the decision to plan for these booster doses.
Dr. Murthy, do you want to address the 16, 17-year-olds?
Sure. So it's a good question. And when it comes to 16 and 17-year-olds and minors in general, we are going to let the FDA weigh in on that, obviously, do their thorough review. And then based on their recommendations and ACIP's recommendations, we will have guidance to share for those who are under 18. I also just want to underscore one thing to your question about the last 5 days in our message. I want to be very clear that what we have said before, which is still true today, is we do not believe that the general population needs booster shots today. That was true yesterday, it was true 5 days ago, it was true a few weeks ago. We are announcing a plan for the future. And that's extremely important. We want people to understand it. This is a plan for the future. And it's based on an assessment of data, including recent data that we have just come across in over the last few days. We have said from the beginning, when we see a signal, we will tell you, and that is what we are doing.
Next question.
Last question. Let's go to Shannon Pettypiece at NBC.
Kevin, we're not hearing a question.
We are not. All right. Sorry, Shannon. We'll go to Brenda Goodman at WebMD and circle back.
Oh, hey, can you guys hear me now? Oh, I'm sorry. I found myself in the mute nightmare.
You got a bit of an echo. Go ahead, please.
Okay. Sorry about that, guys. I just wanted to find out, and I think maybe you answered this a bit, but why are you sort of skipping the typical FDA review process? I know you're saying this is pending FDA review, but why not wait until the FDA's reviewed the safety, the efficacy, and we've gotten that advisory committee recommendation? And are you worried at all about adding to vaccine hesitancy by trying to get ahead of that by making this announcement now?
Dr. Murphy?
Well, I'm glad you asked that question. And I want to be very clear, we are not skipping the very important FDA and ACIP process here. They have an incredibly important role to play in evaluating safety and making recommendations for vaccines. We respect that, we honor that, and that will be a part of this process as well. But the reason that we are not waiting for many more weeks to announce this, it falls into two buckets. One is transparency. We have told the public when we see a signal in the data, we will tell them when we are concerned, when we think boosters may be required down the line. And we are fulfilling that promise today. The second reason is we also want to ensure that people and states and localities and the public more broadly can plan. You can't turn on a booster effort with the flip of a switch. We have to lay the groundwork. We've got to make sure people understand this, that we communicate often about it. So when we were ready to go and start offering boosters, everybody understands what has to be done and who needs to be boosted. And that is why we are announcing this plan in advance today.
So maybe I'll just add that we are very much following what ACIP provided, because they initially advised us on who should be getting vaccinated first. And it is those people who will be the long-term care facilities, healthcare workers, vulnerable populations. It is those people who will be first eligible again.
Okay, so why don't we take the last question, Kevin?
All right, Brenda.
Thanks. I just have a question a little bit to do with the rationale here. So do you have any evidence from the US or from other countries that waning immunity is playing a role in transmission of Delta because it's so highly contagious? Do you anticipate that boosters will help to slow the spread?
Dr. Fauci, you want to go first there?
Yeah, thank you, Jeff, and thank you for that question. Transmissibility is a bit more tricky than looking at a clinical phenomenon such as infection, seriousness of disease, and hospitalization. It is entirely conceivable, and we will be looking at that when you boost and have a high level, and as I showed you on the next to last slide, the increase with a boost is really quite striking, multiple fold increase, that it is conceivable that that would be important in lowering the level of virus in the nasopharynx, which could have an impact on transmission. I certainly hope that's the case. If it is, then you could really get multiple benefits from doing this. You can get benefits for disease, severity of disease. and then ultimately infection and transmission. But the bottom line, with full transparency, we don't know that right now.
Well, we appreciate all the good questions and we look forward to the next briefing. Thank you.
All right, guys. So we were listening into the very latest with the COVID-19 response team from the White House. Again, them suggesting and finally officially saying, yes, they are going to be suggesting the booster shots for those who are fully vaccinated, saying the effectiveness of the vaccine does start to wear the longer that time goes on. So they did say for adults, what they're going to be doing is recommending starting September 20th that you can go and get, those who are eligible, go and get that booster shot, but they want you to wait 8 months after you had your second dose of the COVID-19 vaccine. For some people, that means, although September 20th, they're going to start doing the booster shots, you might have to wait a little bit longer. Again, they want it to try to be spaced out correctly so that the effectiveness can be at the highest percent of chance to help keep you protected as possible. What we're going to do is send some of our viewers off into a quick 2-minute commercial break. We haven't done that for a little bit here, so we're going to send some people off into a commercial break. And when we return, we're going to continue the topic of COVID-19. It's a discussion that many people are having, especially as people return to schools, but also, as you just heard from the CDC, they were saying deaths continue to be a higher number than what they want to see here in the U.S. So we'll have more on that again after a quick 2-minute commercial break. Welcome back here to Live Now from Fox. Christy Larson here at the desk with you on this Wednesday morning. Had to think about that for a second. We're in the middle of the week, but don't worry. No matter what day of the week, Live Now from Fox continues to have you fully covered on all the news stories happening, not only across the country, but also around the world. Now, Afghanistan's been a top story that we've been covering in full for you each and every single day, especially as there continues to be a lot of videos and pictures circulating on social media and in the news industry showing the difficulties the Afghan people are having trying to get to the airport, even though we do have U.S. troops in Kabul right now trying to continue to keep the airfield secure. Again, it's been a lot of trouble for Afghans to get to these airports, to be able to leave the country. So we are expecting later today a State Department briefing. You can, of course, expect a lot of those questions to continue to be asked about Afghanistan, but also we're thinking about the people of Haiti because they've had a lot of devastation happen in their country, not only a lot of turmoil about their political ways, but also they've been hit with that powerful earthquake last weekend, and now they're dealing with tropical storms as well. So we'll also be expecting some discussion on that in that State Department briefing. Again, that's supposed to happen a little bit later here today. But COVID-19 today continues to also be a top discussion point as health officials are now suggesting that, yes, we do want to have those booster shots administered. We heard from the CDC, from HHS, the COVID-19 White House briefing said that starting on September 20th, they're going to be having those who are eligible, those booster shots administered to those who are fully vaccinated. After that second shot dose that you had, you can wait 8 months. That's when they suggest you get that booster shot to continue to keep you protected, especially against variants like the Delta variant, which is much more likely to be contagious as well. So speaking of COVID-19, we do have officials down in Harris County, Texas. Now they are talking about the death rate that they've been seeing not only in the past year, but they're worried about this trend continuing here into 2021. They had an increase of 44.6% of their deaths. So they were up 44% for deaths in 2020. Of course, a lot of that attributed to the COVID-19 virus that had been going through their county. We heard from the CDC this morning. On average, across the U.S., we are averaging of over 500 deaths from COVID-19 a day. So Harris County officials worried about what trends and what amount of increase we could see here possibly in 2021. So let's go out to that press conference as those officials are talking about the vaccine and also their plan to try to combat this virus.
Spanish, after all remarks have been provided. So if you'll be patient with us, I'd greatly appreciate that. I want to thank Dr. Porsa, CEO of the Harris Health System, for being here, along with Gwen Sims, Deputy Director of the Harris County Public Health Department, for joining us. I'm about to briefly go into some statistics from our county analyst office, and I want to acknowledge that Director Katie Short is here to also provide any answers or to clarify any of the questions regarding the data. First, let me begin that any life that has been lost due to COVID is a horrible tragedy. Any life. So if you look at the image to my right, this is also in your information packets. Deaths in the Hispanic community were up significantly in 2020, an increase of 46.6%. For the first time, more Hispanics have died in Harris County than African Americans. Long before the pandemic, I've spoken about the health disparities that we see in Precinct 2, particularly in the Hispanic community. These factors, such as high rates of diabetes and asthma, combined with lower rates of insurance coverage, prove that we must address these disparities. The report also detailed every month from March through December saw an increase in county residents who passed away. 8 of the 10 deadliest months we've experienced in the last decade happened in 2020, and we must do everything possible to prevent that from repeating itself. Now take a look at the image on my left, and this is what I want to make sure that you have. It's the front page of your information package. It doesn't give the entire information. This graph on my left failed to show the full indication of the impact that have taken place, but it shows the breakdowns by month. A huge spike starts in July. In 2020, total deaths from all causes were up 22% in Harris County, 22%. Take a look at that first page once again. In 2020, we had very few weapons available to stop the tide of increased danger and death. Like now, we could social distance. We could encourage people to avoid large crowds and, of course, to mask up, as we are currently doing. However, these safety measures could never be perfect. Today, however, we have a shot to live. And here to talk more about that is Dr. Porsa, CEO with the Harris Health System. And before I ask him to share a few remarks, let me say first, to all medical professionals, to all employees of any hospital or clinic system, but in particularly to the employees of the Harris Health System and to the employees of the Harris County Public Health Department, let me say that we love you, we respect you, we honor you, and we thank you for fighting the fight. But today we're here to talk about the shot to live. Dr. Porsa.
Thank you, Commissioner Garcia. Let me echo what you just said and thank all the members of the healthcare system at Harris Health and also all health systems here in Harris County, the state of Texas, and nationally, truly the frontline heroes who've been helping us overcome this pandemic. You know, I have to believe that almost 18 months into this pandemic, with all the media attention and research, we all know exactly what we need to do to overcome this surge and bring this pandemic to an end. However, knowing things and doing things are not the same thing. The current surge in the COVID-19 numbers, cases, and hospitalizations, and unfortunately even deaths among our children, suggests that a large segment of our population is simply choosing not to do the right thing, not to get vaccinated, not to get their children who are eligible for vaccination, 12 and over, getting vaccinated, not to wear masks when in public, not to socially distance, for whatever the reason, political, ideological, because of the misinformation, it doesn't matter. Personally, I don't understand it, and I am frankly disappointed and sickened by it. It is true that this is a pandemic of the unvaccinated. The number of COVID-19 admissions to the hospitals across the country are vastly among the unvaccinated. Here at Harris Health System, and I've said this now several times, more than 98% of all COVID-19 related admissions to the hospital are among the unvaccinated. 100% of all COVID-19 related deaths at Harris Health System has been among the unvaccinated, 100%. But it is also really important for me to note that the impact of the inaction by the segment of our population who's simply choosing not to do the right thing is felt on all of us, not just the unvaccinated. By not doing the right thing, the unvaccinated segment of our population is allowing this virus to continue to spread in our communities, and not just among the unvaccinated, but those who may not be eligible for the vaccination, 12 years and younger, those with medically underlying conditions that makes them ineligible to receive the vaccine, our elderly who may have received the vaccine but are unable to mount an immune response to the vaccination, they are impacting as well. By not doing the right thing, the unvaccinated population is taking precious resources from all hospitals, including mine, in preventing us from treating non-COVID related conditions, the heart attacks, the strokes, the infections, non-COVID related infections, such as sepsis, trauma. By not doing the right thing, the unvaccinated are stressing all health system staff. Frankly, they're tired, they're exhausted, and they're disheartened because this surge appears to be a lot worse than the previous surges, and also one that was completely preventable. This pandemic and this current surge is not about personal freedom. This is not about personal choice. This is about personal responsibility. And a large segment of our population is simply refusing to practice their personal responsibility. This is about all of us coming together as a community and to do what is right, not for each one of us individually, but for us collectively. As Commissioner mentioned, we now have a new weapon against COVID-19. So again, I'm begging you, please do the right thing. Get vaccinated, get your eligible children vaccinated, wear face masks when in public, wash your hands or sanitize your hands frequently, and socially distance. Thank you, Commissioner.
Thank you.
Oh, I'm sorry. I'm happy to introduce Gwen Sims, the Deputy Director for the Harris County Public Health Department.
Thank you, Dr. Porsa. Again, I am Gwen Sims. I'm the Deputy Director for Harris County Public Health. Thanks to Commissioner Garcia for all his efforts to keep our community safe, and more importantly, for his leadership. Thanks to Dr. Porsa and his staff for all their efforts in caring for our community throughout this pandemic, and for his partnership with Harris County Public Health. Harris County Public Health reports the death totals per year for the 11-year period with the greatest number of deaths recorded in 2020 at 32,727 compared to 11 years prior, 2010, where the numbers were 21,897. In 2020, COVID-19 was the third leading cause of death, with 3,626 deaths. When adjusted for population and age, Blacks in Harris County have the highest age-adjusted mortality rate. Hispanics have been disproportionately impacted by COVID-19 in comparison to other races or ethnic groups. For COVID-19 related deaths in 2020, the death rate among Hispanics jumped 44% from the previous year, of which 22% of deaths were contributed to COVID-19. For COVID-19 deaths among Blacks, 8%, and whites, 6%. The increased circulation of the highly contagious Delta variant makes COVID-19 vaccination more urgent than ever. Current positivity rate is at 20.6% for COVID-19. Harris County residents who are fully vaccinated against COVID-19 as of August 17, 2021 is approximately 46.7%. The most powerful tool that we have against COVID-19 is the vaccine. Face coverings are not a replacement for vaccinations. We want to protect those who cannot get the vaccine. So in addition to wearing face coverings, as Dr. Porsa said, we need to continue to social distance, wash our hands frequently, and self-isolate when sick. Everyone, regardless of vaccination status, should wear a mask indoors, in public places, to reduce the spread of COVID-19. Harris County, via Judge Hidalgo's leadership, is offering an incentive program through the end of this month. Harris County Public Health will provide $100 cash cards to residents receiving their first dose of the COVID-19 vaccine at Harris County Public Health vaccination sites. This became effective yesterday. This will last through the end of the month. To receive the $100 cash card, residents will have to sign a waiver prior to the vaccination and remain in the post-vaccination waiting area at a Harris County Public Health vaccination site for the 15 to 30 minutes recommended for observation. We want to remind residents, I want to say something a little different. Vaccinations at Harris County Public Health sites are free. That's the reminder, and no appointment is required. To find a vaccination site near you, visit readyharris.org or hcphtx.org. Again, no appointment is required. But if you prefer to make an appointment, you can go to VaxTrack, VACSTRAC.hctx.net or call 832-927-8787. Again, 832-927-8787. We want to remind residents that COVID-19 vaccines and testing are free. No appointment is needed. No ID is required. Please find a location near you by visiting readyharris.org or hcphtx.org. Thank you.
Thank you, Gwen. And again, thank you to Director Robinson and all the members of the Public Health Department. Questions, and remember that we have Dr. Serpa here who will provide Spanish remarks to anyone who would like them. And then we have Director Katie Short to answer any questions regarding the data. Yes, sir. The main message is that we have a shot to live, a free shot to live, a shot to live that's available throughout Harris County without any delays, without scheduling. People can walk up to any facility across Harris County, but in Precinct 2, you can walk into my Smart Pods, Access to Health Smart Pods, and receive your test, your free COVID-19 test, and you can receive your free shot to live. Well, it's not free for me. We're going to give you $100 for getting it today. How desperate is the situation right now? The situation is immensely desperate. We are trying to do everything we can to not repeat the amount of lives lost that we had last year. And we can do it. It's preventable. Dr. Porsa was very phenomenal in his remarks. It's about self-responsibility. It's about self-leadership. It's about doing the right thing. We always talk about these things, but now we have the opportunity to do it. So put all the noise aside, forget the politics, forget the ideology. Do what is necessary to save your life and to make sure that you save the lives of others. Dr. Porsa, you want to add some thoughts to that?
Thank you, Commissioner. I guess this is the way I would put it. To everybody who is watching or maybe reading this, we are at a crossroads right now. The runaway train of Delta variant is fast approaching and is about to sideswipe us. If we don't act now, we are heading toward a catastrophe, the like of which we did not get to experience last year, only because we did collectively what needed to be done. Remember last year, we had face coverings. We had limitation of the capacity in restaurants. we closed the bars. So we came together as a community to address a healthcare emergency. Guys, ladies, gentlemen, we are in a crisis. The hospitals are full. I used an example yesterday. I had a person who needed an ICU bed who had been in my emergency room for 40 hours. That is not optimal care. That is not the care that any of you who is watching would like to receive if you came to one of my hospitals. But unfortunately, that is what is happening today, directly as a result of the COVID-19 surge that we are experiencing right now. We are still having patients in our emergency rooms who need hospital beds, ICU beds, telemetry beds. The situation is a little bit better, and I want to take this opportunity and thank the state for stepping in. Today, we received our first batch of crisis nurses from the state, which is going to be a great help to our hospital and other hospitals in this area as well.
All right, guys, we've been listening in as Harris County again tries to address the increase of deaths that they've seen in the last year, hoping that if they get ahead of the virus, that they can decrease those numbers now in 2021. I'm going to send some of our viewers off into a quick 2-minute commercial break. We'll have more on COVID-19 plus news across the country and around the world when we return. All right, welcome back to all of our viewers here with us on Live Now from Fox. I do want to head out to the big board, just giving us a look at what we're seeing here today. This is a live look as we are seeing a little bit of red. We've tried to pop up into that green area, but right now sitting at down 75 points. And we're going to continue to keep our eyes a little bit back and forth on the big board here today. Hopefully we aren't seeing the same numbers that we saw yesterday out there for a stock market. So just wanted to pop that up for everyone as we continue to keep an eye on the economy, especially as there's been a lot of controversy over our drawdown in Afghanistan, the way the evacuations have been going. And since that's been such a topic of discussion, what I want to do is head out to that discussion with the House of Lords. It's another chamber of UK Parliament. We're going to be headed out to their debate. Now, it is a 5-hour debate. We're not going to be playing all 5 hours, but I do want to jump into it, listen into what they have to say about what's going on in the issues happening over in Afghanistan.
There are many issues which are far more important to the British people than that.
Now call Lord Treesman.
My Lords, it's hard to know where to start on an Armageddon of an event, but it is barely surprising. The repeated warnings of a power vacuum, the endless opportunities for Taliban military, social and political position building, the final optics of the US midnight flip from Bagram, and the Afghani leaders jumping ship or switching sides all propelled us to an inevitable outcome. It is pointless for our Foreign Secretary to affect surprise. The speed at which Afghani forces changed sides was amply demonstrated for us in 2001, yet we apparently learned nothing. Afghani leaders failed Afghanistan, but the sudden withdrawal of logistic, contractor and life support were huge failures for the United States and allied forces, although fully understood by all Afghans, including, of course, the Taliban. And apparently we hadn't learned the lessons of Oman about the 30 years it's needed to build an effective army. We've been short-sighted, dim and forgetful. What now? First, we must fully honour our obligation to those we employed, used, befriended, and we must honour those in the heroic allied forces who died, to whom I also pay my deep respects. Second, it's imperative for all allies, multilaterally, to try to shape events by setting out the conditions for future aid and any possible changes in political status. The Taliban may reject all of this, but the alternative is to leave behind a vacuum filled by the Chinese and an untrustworthy Pakistan, by Russians and Iran, complex as it will be for any of them. Of course, the conditions must cover human rights, not least for women and girls. But given we're talking about the Taliban and AQ, there's little ground for optimism. Indeed, we will have now paltry intelligence on them on the ground, or on any terrorist intentions of other malign actors. Thousands of AQ terror prisoners have already been released. It would be mad to underestimate probable radicalization and recruitment everywhere, and not just from state actors. The Foreign Affairs Select Committee, as noble lords have pointed out, shows that 95% of UK street heroin comes from Afghanistan, via the Taliban, Northern Alliance, Russian intelligence, and mafia organizations, mainly coordinated in Brighton Beach, New York. The bodywork of global Britain is badly dented, as is the reputation of our closest ally. The US and everywhere else worldwide will understand this. So please, no more of the hyperbole about British strategy. We don't have one. We never did, other than to give uncritical tactical aid to the United States. The integrated review is largely shredded. We need a rigorous appraisal, starting with the understanding that not all wisdom resides with the government of the day. We've been poor students, my lords, across a number of governments, not just this government. The PM today claims foresight. He actually lacked foresight, insight, or even good sense. How mad to follow the lunacy of the Trump-Taliban deal, surrendering a unilateral withdrawal date in exchange for nothing. And how thin the relationship with President Biden. How true the noble Lord Howard's judgment that it may be a defining moment of his presidency. Our defining moment will only come when we grasp that we have pretended omniscience when the reality has been threadbare understanding.
Call Lord Berkeley of Knighton.
My lords, this has been a sobering debate indeed, and speeches have rightly been unanimous in their support for our armed forces, our diplomats, BBC journalists, and the women and girls now at risk. I endorse too the pleas for the support of religious freedom in Afghanistan. But those predicaments could pale before the enormity of a geopolitical shift that would see the Taliban aligning with China and Russia, as warned by my colleagues, Lords Alton and Stirrup, Lord Hannon and Baroness Altman. Writing in the Times yesterday, the noble Lord Haig warned us not to turn our backs on future interventions, and he cited our work in Kosovo. But what we have learned once again today is the danger of interfering in other cultures, particularly tribal ones, without a carefully considered exit plan. As Vietnam and Iraq foretold, vacuums are inevitably filled by warlords or groups whose aims are at odds with that of the free world and frequently lead to an even worse situation than that which we sought to improve. We cannot and should not conflate the cultures of other societies and cultures with our own. But from the Crusades on, I fear that's exactly what we have done so consistently, as the noble Lord Dobbs colourfully described. Like him, I too found Ben Wallace's interview moving in its honesty. I dared to hope when I saw the Taliban press conference that there might be some hope that the Taliban of 2021 is not that of 2001. But we've heard anecdotes and warnings from colleagues better informed than me that we should be very skeptical about whether this is really so. Nevertheless, jaw must, for the time being, be preferable to war, even if it's ultimately a doomed exercise. After all, we do business with other countries that invoke Sharia law, however foreign it may be to our values. I therefore have a specific question for the Minister. Will the government please keep the House informed after the recess on just how the Taliban are behaving on the ground, how they're treating women and children, whether freedom of religious belief is being allowed, or are they, as Lord Vasey mentioned, pursuing artists and musicians? My second question is this. Was there no intelligence to suggest the unadvisability of a withdrawal while the Taliban was seasonably in the cities, as opposed to the winter when they tend to withdraw? If so, was this intelligence ignored? Thirdly, is it true that a countrywide disgust at the corrupt failings of the Afghani judicial system, despite the rise of women judges, has meant that there's more support for a return to Sharia and the Taliban than otherwise might be the case? I agree, finally, with the noble Lord Lamont, that we need to come better to terms with our current place in the world in order to inform our future interventions, which I pray will be few and far between.
Lord Godson.
I also, Madam Deputy Speaker, noble lords, wish to associate myself with the remarks made in tribute to our forces, our civil servants, public servants, aid workers. Many have done so already today, but I think it's important that they at least hear the total unanimity and solidarity of this House at this time. It's been a hugely important debate and privilege to listen to, and it is, as several speakers, including noble and learned Lord Howard, have said, it is maybe an inflection point for the future world order, and particularly also for our alliances going forward. The role of the United States, of course, has been central to all of this, and the administration has been rightly criticised, I think, again, unanimously. At least I have not heard any speaker defend the Biden administration's decision here today, and a uniquely personal decision of this president, who has a longevity of view about the necessity of withdrawal from Afghanistan. It has been a shameful and a graceless decision, expressed in graceless ways, with, as has been noted, insufficient tribute to the Afghan security forces who gave their lives, and indeed to Allied and NATO countries whose forces, notably our own, also gave their lives. But the Biden administration is not the totality of America, and through much of my political life, being born an American citizen, I've noticed many pessimistic predictions for the US after previous debacles, perhaps none quite as serious as this, which rolls in many of the features of past debacles all in one spot and one fell swoop. But we can all remember the pessimism about US retreat in Vietnam in 75, the debacle of the hostage crisis in Iran 79 to 81, when the Khomeini regime humiliated the administration of Jimmy Carter. I was working in America when the debacle of the bombing on the US Marine barracks in Beirut and the subsequent humiliating withdrawal of US Marines and other forces took place. So I can well remember all of those things. The one thing which I would say at this moment, because of the Biden administration, is not the totality of the United States and of its polity, is that America has an enormous resilience to bounce back from these debacles, to reappraise, to regather, and to regroup. It is interesting, despite the implication that for political reasons that the Biden administration withdrew so rapidly from Afghanistan, it is interesting that the latest polling numbers indicate a 20%, from Politico pollsters, indicate a 20% drop in US public support already for the withdrawal from Afghanistan. So humiliating and abject are the terms, even though they do not object per se to the idea of the withdrawal, the way in which it's been conducted is very obviously so unsatisfactory and degrading as to prompt that. So it is not the totality of the United States public opinion either, and it may be that in the coming days and months, anti-interventionist groups such as the Quincy Coalition will see a further erosion of their support, as well as the American public takes a look at what has been done in their name and whether that is indeed in the United States' national interest as well. As far as wider alliances and partnerships are concerned, I make one final point, that there needs to be a very serious reappraisal of our relationship with Pakistan. Several speakers have already alluded to it. It's a complex country, complex motives, complex system of government. But I would ask the Minister whether he would be willing to consider the possibility, since the UK government has just set up an Office of Net Assessment, to have a net assessment of our relations with Pakistan and broader countries in the region, to have a sort of overall look at, now that we have this inflection point, as to what can be done here now. I give way and thank on.
Now call Lord Garnier.
My Lords, I draw some comfort from what my noble friend Lord Godson has just said. But as many have already said, there's no benefit today in complaining about the actions of the United States in pulling out of Afghanistan, or the casuistry deployed to justify their decision, despite the obvious and terrible consequences of their doing so for the people, and especially the young women and girls of Afghanistan, who face a dark future of repression and sexual abuse. But if the 20-year sacrifice of our troops and the appalling events in Afghanistan of the last few days tell us anything, and I wish it were otherwise, these events highlight some of the unwelcome but undisputable truths about our own country, our international standing, our government and its leadership, which cannot be ignored. My noble friend Lord...
All right, guys, do want to say thanks again for being here with us on Live Now from Fox. We have quite a few events that have been kicking off here that we've been pulling into our Live Now from Fox desk. So I want to continue to switch gears. What we're going to do is send some of you off into a quick 2-minute commercial break. But when we come back, we're going to be continuing the topic and listening in as leaders are discussing Afghanistan. This time, instead of the House of the Lords, we're going to be headed to the United Nations as they discuss Afghanistan, and especially as we are continuing to see just pictures and images of the chaos and crisis that has been going on there in the country. So again, some of you going off into a quick 2-minute commercial break. We'll see you here on Live Now from Fox when you return. All right, let me start pulling this stuff in. 2. You know, I was gonna say LTN 8, but it's kind of just a blank screen right now. So, yeah, let's just do that. Okay, so
the picture now is different. Thank you.
Thank you. With regards to the number of Afghan refugees outside of the country, we have some 3 million Afghan refugees, mostly in Pakistan and Iran. In Pakistan, some 2.4 million, and in Iran, some 1 million. So a large number of Afghans outside in neighboring countries for the last 40, 20 years. With regards to whether Afghans will return, we don't see large numbers returning now. People are taking a wait-and-see attitude to ensure that the security situation stabilizes before they return. And definitely, if Afghans decide to return, UNHCR, as well as our partners, will assist them and help them to reintegrate. Over.
Thank you. Does anybody want to take the second part of the question as well?
Well, with regard to the perception about the Taliban, as you know, we are only 72 hours into that power shift, and in fact, we have, as I said, we have seen some encouraging signs, and for us as operational humanitarian agencies, the proof would be in the actual implementation of our activities on the ground. And for instance, on the issue of girls, we would be able to, take a position on this once we have completed the rollout of our community-based education program. We understand that, and we hear the statements that have been released. And our position is that we will see the results, the outcomes of this position at the operational level, when the people needs our humanitarian assistance.
Thank you. Michelle Nichols, and then we'll take one or two more questions. Go ahead.
Thank you. Thanks so much. Just a question on the airport. For now, it's under US control. Do you know how long that's going to be the situation, and who might take over after that? What's needed? Is there a role for the UN? Thanks.
Mary Ellen, do you want to try that?
Yeah, I'll do that. Yeah, we don't have visibility yet on how long the US will be there. It will very much, I guess, depend on the progress of the exercise that they're carrying out at the moment in terms of the evacuations. And then it will. I mean, it's not. We don't have the visibility on what's going to happen after that. I mean, there had been talk before about the Turkish securing the airport, but certainly in terms of access in and out of Afghanistan, I mean, having the airport up and running to international standards is going to be critical. And this is something, we will be assessing over the next couple of weeks on how that evolves, because I mean, that's going to be a critical lifeline for the humanitarian action in Afghanistan. So it's critical that it gets up and running, but it's a work in progress, and watch the space, I think, at the moment. Over.
Thank you.
Have you already started talking to the Taliban about it?
Yeah, we have made outreach to try and assess who they've appointed. We normally engage with the NGO Commission. The initial feedback we have had is to be a little bit patient. However, we're going to try and we are in the process of following up on that, underscoring the importance and the priority to try and get a solution for the airport going forward. Over.
Great. Well, we're going to take a couple questions from the screen. Margaret Bashir, VOA. Margaret.
Hi, thanks for the question and thanks for the briefing. I just wanted to follow up with Hervé on your answer to James Reinl. When you said just before this final phase, you were opening these community-based education schools in Taliban-controlled areas. Could you just be a little more specific how long that's been, like in terms of months, weeks? How long have you had them open and their level of cooperation? That would be helpful. Thanks.
Hervé, do you want to try that one?
No, I'm not.
No, we can hear you. Yes, go ahead.
No, I mean, the community-based education program started last year, and the program kept running until we had there was measures taken by the former governments to close all the schools due to COVID. So, and then after this measure was taken, the conflict erupted, and then since then the schools have been closed because of the combination of the COVID measures and the conflict. But now the school have been reopened, and I mean it's a slow process. As I said, we have early indication that in some of the towns and some of the communities, children are going back to schools, including girls. We are gathering information with our partners and NGO partners and extenders out there. We'll have a much clearer picture probably in a week or two about what's really happening out there. Over.
Thank you. Iftikhar Ali.
And Hervé, could you just tell us up to what age the girls are? Is it just primary school, high school?
No, it's primary school.
Iftikhar Ali.
Thank you, Steph. Iftikhar Ali from Associated Press of Pakistan. The key questions have already been asked, but may I ask, what is the atmosphere? May I ask from the UN colleagues based in Kabul, what is the atmosphere like? Are the government offices and fully functioning? Are the markets open? And people out in the streets, especially women?
Which one of you want to take? I don't know which one. How many of you have been actually outside? But if one of you could take that question.
Yeah. According to reports that we're receiving, including from our staff members, is that things are slowly returning to normal. A female staff member told me she went outside today to see the situation, and she was able to walk around, look around, and some markets are opening as well. That's the information that we have. I don't know if the other colleagues would like to add.
For security reasons, we have not been able. We have not been able to leave the compound yet.
Okay, Mary Ellen, were you trying to say something?
Yeah, the colleagues that have been going up and down to try and access the airport are telling me that it's calmed considerably since Sunday today, but there is still, it's far from normal. I guess it's a new normal. I mean, shops little by little are starting to open up. We are seeing some, more of the national colleagues, pop into the office. But I mean, it's slowly, things are opening up a little bit, but there's still, I think the evenings, I understand still, there's quite a bit of criminality and stuff floating around in the evenings. Over.
Thank you. Betul and then James, and then we have to let our guests go.
Thanks, Steph. I was wondering if we could just get a reaction from you to what was said by the Taliban spokesperson yesterday. Were you satisfied with what you heard? And given the history, do you have any concerns? Do you trust the Taliban?
Mary Ellen, do you want to? Go ahead, Hervé. Go ahead.
No, as I was saying, we have heard the statement from the Taliban, and for us, we are operational agencies operational humanitarian agencies. You know, the verification of what was said will actually happen when we deliver assistance on the ground. And I mean, this is only, as I said, this is only 72 hours since this shift has happened. We need time, you know, to sort of assess whether this statement, these commitments are actually translating into real action on the ground. Over.
Thank you. James, then we have...
Yes, if I can ask Mary Ellen with her UNHAS hat on, just if you wanted to operate flights at the moment out of Kabul airport, are NATO allowing you to? Also, the UN has its own terminal there. You have your own aircraft. We've seen the scenes on Kabul airport. Is that secure? Are the aircraft operational at this point? And one final question to any of you that want to answer. We heard the news at the beginning of this briefing about people being relocated from Afghanistan. That doesn't sound like it's your national staff. Can you tell me, what are your national staff telling you about themselves and their dependents? Do they all want to stay, or do some want to leave?
All right, Mary Ellen, if you could start with the airport logistics question.
Yeah. Okay. We're still working on access to the airport. As I said, the airport and its surroundings, particularly the civilian side, did sustain some damages during the events, particularly on Sunday and Monday. So we're still working on assessing it. Two of our aircraft also sustained some damage, so we're assessing those. We are looking now at options, how we can resume.
All right, guys, do want to say thanks again for being here with us on Live Now from Fox. We're going to continue to give you more of these live events happening across our country. I do see we have Senator Mitch McConnell. He's the Republican from Kentucky. He's speaking with cameras right now. Let's listen in live on Live Now from Fox.
And our friends out of the country.
Do you think it is a threat to American public safety with the Taliban now in power?
Yeah, I mean, we're back where we were 20 years ago, with the Taliban in power and Al-Qaeda on the way back. And Al-Qaeda, of course, was the gang that hit us on 9/11.
Senator, Governor Beshear and state public health leaders are essentially saying Kentucky is rapidly approaching critical levels when it comes to COVID-19 here. What is your response to that? And then also, in the midst of this, there's this argument over masking, specifically in schools. What is your take on that? Given that many children cannot receive the vaccination yet, should they be masked inside schools?
First, the solution is vaccines, vaccines, vaccines. With regard to public health safety issues like that, the masking issue that you raised, I'm going to leave that up to the governor. That's part of his portfolio and not mine. What I do know is that 97% of the people in hospitals in Kentucky and across the country have one thing in common. They were unvaccinated. So I think for everyone who's eligible, vaccines, vaccines, vaccines are the solution to the problem.
There is news about boosters now being recommended for people 8 months after they receive their last shot. Are you encouraging people to follow through on that booster as well? Will you be receiving it?
Absolutely. If they recommend I take a booster, when my turn comes, I'm going to take it.
What can Congress do to help potential refugees get out of Afghanistan?
Well, I've been talking about that. I mean, this is an administration job to organize the rescue of people who are behind enemy lines now as a result of this ill-advised, catastrophic decision to withdraw. We're going to be investigating what happened. I think it's noteworthy that 3 of the Democratic chairmen in the Senate announced yesterday they want to start holding hearings about what happened, what went wrong. And we need to get to the bottom of that. In the meantime, if the administration feels like they need additional resources in order to complete the rescue, I'm sure we'd be open to that. They created this catastrophe, but we'll be glad to try to help them get out of it if they need congressional assistance.
Do you trust the Taliban's claims of being more peaceful this time around and granting more freedom to women?
You mean a new and revised Taliban? Who knows? I'd be pretty skeptical. These are barbarians. Barbarians. I worry about the Afghan women and children who will be stuck there. And this is a totally unavoidable tragedy.
If the governor imposes a mask mandate, will you be supportive of that?
Well, I'm going to follow the rules in Kentucky when I'm in Kentucky. And for example, at the where we are today, we were all told to wear a mask. I did. I'm not going to second guess him on that issue. That's his job and not mine.
What do you think about it?
Thank you all. That's enough.
All right. Senator Mitch McConnell wrapping up remarks. They're answering a number of media questions. Do want to say good morning and thanks for being here with us on Live Now from Fox. We have been keeping tabs on a lot of different events that are taking place right now, but I do want to jump out. We just had a school board meeting kickoff down in Hillsborough, Florida. Now, the reason why we're going to head down to Florida, well, right now they have more than 10,000 students, more than 300 staff members who are out quarantined because of COVID-19. This is an emergency board meeting. Let's jump into it. Listen in live right here for all of our viewers with us on Live Now from Fox.
Is to involve you, the public, in what we do.
You are welcome to email or meet with any of our board members and follow our district on social media. Board meetings are covered live by Hillsborough Schools TV on Spectrum Cable Channel 635 and Frontier Cable Channel 32.
Meetings are streamed on our website at hillsboroughschools.org. Closed captioning is provided on all broadcasts, and past meetings are available in our online archives.
We are interested in what the public has to say. We'll include time for audience comments before we address our business items. Our agenda and any supporting materials can be viewed online in advance. They're posted 7 days before each meeting on our website at hillsboroughschools.org.
Our vision is preparing students for life, and that means all students, every day. Todos los estudiantes, todos los días. Thank you for your interest in education. With your help, we're making decisions that shape our community's future.
The emergency school board meeting of August 18, 2021 is now called to order. Member Hahn, will you now lead us in a moment of silence followed by the pledge?
Thank you, Member Gray. Please bow in a moment of silence. Thank you. Please stand for the Pledge of Allegiance. I pledge allegiance.
And while they do the Pledge of Allegiance, just wanted to reiterate why we're going to be listening into this meeting. Now, again, as you can see, more than 10,000 students, more than 300 staff members quarantined right now because of COVID-19. Now, Hillsborough School District down in Florida, it is the 7th largest district in the United States. So this is obviously a very important story, especially as children are headed back into the classrooms. We're listening in live, on Unfiltered here on Live Now from Fox.
By Member Washington. Any discussion? Seeing none, please vote when your lights are on. It's unanimous. Let the record reflect that all board members are present either in the boardroom or by remote. Board members, Superintendent Davis, and staff, I've called this emergency meeting to highlight the reality that our Hillsborough County Public School District is in a public health emergency. With quarantine and isolation numbers reaching over 10,000 and actual student infections of this Delta variant reaching now over 1,400, we must act and act now. Florida now has over 15,441 COVID-19 patients, which is factually stretching our local hospital capacity to the maximum amount of ability to take in new patients. I am reminded from those statistics alone that the cost now of inaction will endanger the health and safety of our students. We are also reminded that our number one priority as school board members and our superintendent is the health and safety of all students. For the public, please understand that board members who are sitting here today, our superintendent, and the entire district staff are under an executive order, 21-175, which declares state and grant funds will be removed should we make masks mandatory. This is along with Emergency Orders 6AER 2102, which states there will be there will be Hope Scholarship transfers for even engaging in mask-wearing conversation. And additionally, Emergency Order 6AER 21-01, with new and more stringent student attendance parameters of teaching and learning during students' quarantine absence. We also recognize the recent federal government involvement will mitigate any penalty that may be implemented by the DOE if, and that is if, we proceed with changing our mask-wearing stance. At this time, we will allow for public comment, with the full knowledge that there must also be time for lengthy board discussions afterwards. Member Hahn will now read the board guidelines.
Thank you, Member Gray. Sorry. Thank you. As we begin this afternoon's meeting, let me quickly review the format of our school board meetings. Please silence all electronic devices. There are speakers in the room behind me that allow board members to hear the meeting upon stepping away from the dais. This meeting can be viewed with closed captioning on the live webcast on cable TV and on video monitors here in the auditorium. It can also be viewed with closed captioning in the online video archive.
Thank you, Member Hahn, Co-Chair. Board members, we have scheduled this meeting to last until 3:30 p.m. We will have at least 1 hour for public comment, which looks like we're going to go over, which is fine. I hope that board members will agree to that. So we may go over an hour. That will leave approximately 1.5 hours for board discussion for the one agenda item on today's agenda. But because of the gravity of the issue and the enormous amount of public interest in the board's discussion, I will waive board discussion for a limit up to 5 minutes, only also to expect another round of board comments afterwards. So we'll go back into the queue. I am going to ask you to be thoughtful in your comments about the length of time you speak and to be considerate of other board members who will want to comment. I will use my duties as chair to keep the discussion civil and to keep it moving, and I will respectfully remind you to allow all board members a fair opportunity to speak. Public comment. We've allocated originally an hour, but we are now adapting to the fact we might go over an hour. The board welcomes your comments from citizens and values your input to the board. In order to provide the most comprehensive response to your comments, our staff will follow up with you and will keep our board informed about the responses. Our school board respects the public's right to speak to the board, and we appreciate you taking your time to be here. However, it is requested when you address the board that comments are not directed personally against board members or staff members, but rather directly at the issue. Any behavior intended to interrupt the orderly conduct of this meeting will not be allowed. Our civility policy is in place. When addressing the board, Quickly state your name and speak clearly into the microphone. As a reminder of our way of work, we have allotted at least 1 hour, perhaps more, for public comment. Each speaker will have 1 minute, and I will now call up the first speakers. Please begin with Jessica Cohen, Crystal Jacovino, Cliff Gideon, Humai Kumar, followed by Dr. Rendy Samford.
Hi, good afternoon. Just want to let you guys know that I was all harassed outside by standing by myself for wearing a mask. So I want to come to you with the highest amount of respect. Thank you today for allowing me to speak. I urge you to enforce masks and no longer allow an opt-out option, essentially reverting back to 2020 COVID policy. You're putting children at high risk, and potentially the whole classroom is taking the brunt force of the education when they have to now quarantine due to your inability to practice social distancing or to enforce masks. As a result of your decision, you have seen horrific number of COVID-19 cases among children, or you are the lead to blame for the overcapacity of local walk-in clinics and hospitals. Thank you.
Oh, you have 30 more seconds. Yeah.
Your job is to teach, inspire, and to keep them safe. You cannot do this properly when you don't treat your system how you currently are. Today, I urge you to stop being reactive and be proactive for the sake of your children. Thank you for your time.
Thank you. Next. And please state your name. There will be a bell or some type of bells and whistles that will indicate 30 more seconds. Crystal?
Hi. I'm Dr. Crystal Jacovino. I'm an endocrinologist and an internal medicine physician, and I'm here representing over 200 local physicians in the Tampa Bay area. We've come to ask you to put back the mask mandate. The American Academy of Pediatrics recommends that all persons in school, regardless of vaccination status, wear masks. And the CDC says that all unvaccinated people should continue to wear masks. This is especially important in buildings with poor ventilation. We're seeing breakthrough vaccinations in vaccinated individuals, and only 43% of individuals in Hillsborough County are vaccinated. Last year, you had a USF pediatric infectious disease group that helped shape your policy. Where are they now? I asked all of the USF physicians that I can find, and none of them said that they were asked anything about the board. You don't know about the 17-year-old prone, sedated, intubated on 100% FiO2. You don't know about the 16-year-old in the ICU on high flow.
Thank you. Next speaker. Cliff Gideon.
Yes, ma'am. Thank you for letting me speak. I know that you guys have a thankless job, but I'm blessed to be here instead of being in Afghanistan where there is no rights. I'm vaccinated. My kids are 11. They go to Williams Middle School. When it gets approved, they will get vaccinated because I believe in the mRNA technology. I also have opted out with them for masks. One of my daughters has a speech problem, so therefore the mask mandate is not good for her. Now, there's 1.5 million people that live in Hillsborough County, of which 40% of eligible vaccination have not taken the vaccination. COVID's not going to go away. It's going to be here with us forever, okay? I hope not, but it is. So you have to have a policy of just not mask on, mask off, mask on, mask off. Let's have the opt-in function. Either that or go back to the way it was last year, because they did in school last year.
Thank you.
Thank you.
Humai Kumar, and pronounced differently. Pronounce your name.
Umi
I
Kumar.
apologize.
Good afternoon. Thank you for letting me speak. I am Dr. Kumar, a pediatric hospitalist who has been having the privilege to take care of the community and the children of Tampa Bay for over the last 3 years. And more importantly, I am a mother of two, one of whom just started kindergarten in our public schools at Hillsborough County. In the last week, there have been multiple students who have been positive just in his classroom and have had to be quarantined. As a physician and mother, I am here after working an overnight shift to urge the board to mandate masks for all students, staff, teachers with no opt-out option, and to mandate vaccinations to those who are eligible. In over 1 week, 5,000 students have had disruption to their education and have had unnecessary exposures to those students positive with coronavirus. This has a rippling effect on the children's hospitals in the area. Physicians, nurses, and all supporting staff on the front line are tired, frightened, and anxious as we are not even at our peak. Hospitals are full and there are not enough beds for our patients.
Thank you. Thank you very much. Dr. Wendy Sanford, and then we'll start with the new round. Scott Taylor, Scott Hottenstein, Amerlin Rhodes, and then Corrine Perez. Thank you.
Thank you for letting me be here. I appreciate speaking to all of you. When I woke up this morning, I had no intention of being here. I've never been to a school board meeting before. I'm busy, as are you. My granddaughter told me there was a special meeting, so I thought, what's it about? Mandates. So I did a quick Google search, looked up DeSantis mask mandate. Here's what I came up with. Executive Order 21-175. I'll read one section to you because we don't have time. The Florida Commissioner of Education shall pursue all legal means available to ensure school districts adhere to Florida law, including but not limited to withholding state funds from non-compliant school boards violating any rules or agency action taken pursuant to Section 1 above. What does that mean? I ask you, do you have enough money to run this school district without state funding? If the answer to that is no, then this is a waste of time for all of us to be here. And your time is valuable, my time is valuable, everyone out there available. Please, please, don't waste time.
Thank you very much.
All right, once again, we're listening into this emergency school board meeting after more than 10,000 students, more than 300 staff members have been quarantined due to COVID-19. A lot of controversy on whether students and staff, regardless of vaccination status, should be mandated to wear masks, should they not. Of course, their governor has one stance, school boards, doctors, everyone has their own opinions. We've been listening in a little bit. Our audio got a little bit off there, but what we're going to do is send some of our folks off into a quick 2-minute break. We're going to switch gears, give you more news happening across the country, again, after a quick 2-minute commercial break. Welcome back here to Live Now from Fox, taking a look at the big board as we continue to see red heading into another day of it. This time, though, at least we aren't down in that 400-point mark, only seeing that 63 there. So we'll continue to pop up the big board throughout the day until that closing bell happens, and hopefully we do see some more green here in just a little bit. But I do want to let all of our viewers know we are continuing to keep an eye on a number of different live shots that are coming in from across the country. Here's one coming out of the D.C. area. We do have World War II veterans who are going to be honored during a ceremony here today. We'll be bringing that to all of our viewers here in just a little bit. Until that time, though, I want to head out to a story. Deshaun Watson, again, he is the football player who's now been accused by more than 20 women of sexual misconduct. Well, the lawyer representing all of those women says he was contacted by the FBI. Well, now Deshaun Watson's attorney has been answering to those claims. Let's go listen into what he had to say about this situation.
Mr. Buzz, and by the way, this thing of sexual trafficking that everybody's talking about, that's nothing new. Mr. Busby talked about it in one of his petitions that he filed and made the allegation. So if the FBI is going to investigate whether Mr. Busby, one of Mr. Busby's clients, is trying to extort money and committing illegal acts, they're certainly going to want to be able to tell the public later, if there is an outcome of charges of something, that they looked at both sides and that they looked at the allegations of the other side as well as allegations of extortion. So I welcome the investigation to look into all of it. We will continue to cooperate with them in any way they want. We have from the first cooperated with the Houston Police Department, cooperated with the District Attorney's Office, and we'll cooperate with the FBI, and ultimately, down the line, we'll cooperate with the NFL, because we know Deshaun has done absolutely nothing wrong. And the reason I say I didn't want to be here for this is that these kind of things should not be worked out in the public. They should be privately conducted so that innocent people are not harmed. But I do want to make sure everybody understands, if Mr. Busby continues to put his clients out, presenting them to Sports Illustrated, who, by the way, if we want to talk about agendas, the Sports Illustrated reporter that keeps writing about this, and one time in an email to me, referred to Deshaun's as yet unproven innocence, which reflects sort of an attitude. But regardless of that, he keeps putting these people out there, and then having people say different things that we know we have documents for are untrue. We're going to be forced to respond. We have tried as hard as we could to not be trying this in the public domain. That is not exactly the way it's supposed to be done. I do want to serve notice that if people lie to the FBI, that's a felony. So I urge you, if they contact you, to tell them the truth, whatever that is. We do not want to get in the way of anybody expressing themselves about this. The whole reason there was never even settlement or discussions or Mr. Busby wanted something is we have insisted from the beginning that everything be public, except private investigations. I can only conclude that Mr. Busby's knowledge of the criminal justice system and the way it's worked, probably if you put it in a thimble, there would be a lot of room left. What he's done here is harmed his clients and harms investigations that need to be confidential. But when he chooses to go public like this, then he better be sure his clients are telling the truth. And let me give you an example. I have here that I wanted to call to your attention, and then I'm through. If you remember, the whole tone of these issues changed in March. First there was a lawsuit by a woman named Ms. Solis. Then there was another lawsuit, and the third lawsuit, for the first time, alleged some type of force and very, very descriptive language as to how mortified she was and how upset she was. The woman's name is Shanae Lawson. Shanae Lawson is not a woman that has made a criminal complaint, but she's certainly sued. And if you, excuse me, if you look at her petition, it is very graphic as to how horrible this experience was and how she was harmed. She is the woman that is being looked at as far as an investigation for federal authorities and how she went about this. But let me just read to you, if you look at that petition, I'm going to read to you text messages that she sent to Deshaun Watson that very after the massage that she says so traumatized her and that she's talked to people about. Hey, Deshaun, the massage was that morning. Hey, Deshaun, just wanted to say thank you for trusting me with your massage today. I'll be here till January the 3rd if you'd like to get another one. And I urge you to go look at that petition and see if that email, or text rather, is consistent with her petition. And then, I don't have a date on it because it's not it. It's going to be after that one, probably the same day, could be the next day. She writes on a text, I hope all is well. I just want to say, I apologize for my actions. That was not me. And if I could take back that moment, I would. I really devalued my integrity and profession. My sessions have never went like that. I feel really horrible as a person. This is the woman that later in a lawsuit alleges that he forced her to have oral sex. And then she's very descriptive about how horrible the experience was. And then she writes him, "Hey, Deshaun, I know you're probably busy, but can you scan me the executed copy of the original NDA, Non-Disclosure Act, you have via email? Also, I wanted to ask you to know if you're interested in a follow-up call to make sure we're on the same page about a game plan moving forward." Now, that's just one of the 22. It is the first that alleged force. And I suggest to you, it is demonstrably untrue. And Mr. Busby's not doing her or anyone else any favors to start going public about FBI investigations, because the initial FBI investigation was of this woman. We don't talk about these things because they're not fair to people. But I do want to serve notice to everyone. If you decide to continue to make these comments publicly, instead of working with law enforcement as you should, then we can always respond. And the truth is not going to be your friend. I hope that everybody will just back up and relax now and realize orderly investigations are going on. Houston Police Department, we've given them information. I'm sure Mr. Busby's people have, and they are diligently investigating. I've met once with the district attorney's office, just with the woman who's in charge, and she is the chief of the human trafficking division. That doesn't mean they are contending there is human trafficking going on. That's who she is. Mr. Busby's made that allegation. I'm sure the FBI will look into it. But at the end of the day, we're going to continue to cooperate with her. She's assured me that they would be fair and they would be open-minded to both sides, and that they will treat both sides respectfully. And I take her at her word. The police have said the same thing. The FBI has said the same thing. I take them all at their word. And they need to be left to look at these things in a very confidential and careful, professional way. Going out and talking about this stuff does no one any good. I remain absolutely, irrevocably convinced Deshaun Watson did nothing illegal or improper. And I'm confident that all of those investigations will show that. But I do believe we just should leave law enforcement to their professional duties rather than constantly having these press conferences and stuff. I didn't want to be here, but I am not going to let this stuff go unchallenged. But I do want everybody to take a breath. Sometimes I feel like, and then I'm through, I feel like Rodney King to the side side, can't we all get along? And my version will be, not can we all get along, can we all just calm down? This is nothing new about this. One final thing. Some of you got excited, or not some of y'all, but some people got excited about grand jury subpoenas going out. That is standard. We have known from the beginning, and the prosecutor has told us from the beginning, that ultimately when their investigation is over, their findings will be presented to a grand jury. We will be given the opportunity to appear, to put whatever evidence we want in, to tell our side, and we will get an even-handed hearing. So the FBI interviews and conducts investigations, thousands on an annual basis, and ultimate charges are in a very small number. So the fact that somebody's investigating something means nothing more than they're investigating, trying to make sure there wasn't a crime. I urge everybody, just take a deep breath. Let it run its course. I promise you, nothing's different today than it was 4 months ago, except they are learning a lot more, and we'll await their verdict. I appreciate y'all showing up. I'll take a couple of questions, but not much.
Leslie, just to clarify, your awareness of the FBI also potentially investigating Deshaun, that's based solely on Tony's comments?
I don't think they're investigating Deshaun. Yeah. What they are investigating is the allegations Busby has made in his lawsuits. As I said, I didn't know about that until yesterday, and then I checked it out. That's true, they are. But I wasn't supposed to know. But what this is the thing that makes me uncomfortable. To say somebody is investigating whether certain events occurred or did not, or whether they're investigating somebody who has a dog in the hunts version, does not mean they're investigating necessarily the person that's being, they may, but that's not my sense. My sense is Mr. Busby and his clients have made allegations. They're investigating those allegations. But that doesn't mean that they believe or think or are trying to see if Deshaun is guilty of something. They want to know what happened. Then they can talk to lawyers and decide whether that is something improper against the law. It's that process that I'm totally comfortable with.
So, Rusty, earlier you pointed out that the FBI made an inquiry about the claims from Ms. Lawson of a possible extortion claim.
Yes.
And then later on, you said yesterday you found out that now they're investigating Busby's claims. Is it your understanding that these are separate investigations, the same investigation, and so that's one part. And then also, would you also be representing Deshaun in another claim from the FBI as well, if there was a criminal side to this?
Until I get fired, I'm representing them in everything having to do with this, okay? Good question. My sense is, but look, the FBI is not going to tell me anymore, they're telling y'all, all right? They're not going to conduct, if you go to them, they're going to say, we will neither confirm nor deny. That's what they always do. And until Busby started doing this, all of us in the private sector don't say anything about it either, because it's not to anyone's advantage to talk about it or even say that it happened, all right? Busby's conduct here, you have to understand what's happening. When he goes a month without y'all putting him in the paper, he just almost wilts, okay? And until y'all give him some coverage, when he goes a month without it, that's what happens. What he does is he comes out and he wants to leverage his civil lawsuits. He wants out of those civil lawsuits. He knows those lawsuits have no future in the long run. But he wants to be out there and promote himself in the lawsuits and try to get Deshaun to settle them, to pay them the money so he can ride into the sunset. Now, I don't quarrel with people covering or anything, but what I'm saying simply is, if you guys shut down and nobody heard Tony Busby's name or said it for 30 days, there would be a new allegation and a new piece of information he shouldn't be talking about in order to gin it back up. What I'm saying is, I would like to avoid having to respond to every one of those, but if people are lying and putting it publicly, we're going to have to do it on behalf of Deshaun, and I'm urging him to take a vacation, go back on another honeymoon, quit doing all this. It's not good for your clients. It's truly not, because every time they talk publicly, they say things that are contrary to what there's documentary evidence of. And we want to do that, present that in a courtroom. And we hope that he'll calm down a little bit. I'm not confident that he will, but he needs to be careful because he's not helping these folks.
Has Deshaun spoken to the NFL investigative team yet? And if not, what is the timeline
No,
for that?
good question about the NFL. The question was, has Deshaun talked to the NFL? And I should have repeated the other two questions because I'm not sure anybody following a live stream got it. And I wanted to keep this short, and I'm already over, but I'll try to answer that question. I think the NFL's gotten a bad rap publicly about this thing, and I'd say this with some reservations because I don't want the NFL to think I'm trying to cuddle up to them, because they may reach a conclusion down the line we disagree with, and we'll be fighting with them. So I don't want them to misunderstand. But here's where they've gotten a bad rap. They're doing their own sort of investigation that we're totally unaware of, not consulted about. Question is, has he talked to them? The answer is no. And here's the reason. The NFL regularly tries to not reach out to the defendant and his lawyers and seek evidence from them until the criminal investigation's over. Historically, and I've run it, they want to make sure they don't interfere with the criminal investigation. When the criminal investigation is over, then they will do their own separate finishing episode. They have, as y'all know from the media, they have apparently talked to some of the women. I have had no contact with the NFL except to call initially and say, whenever the time is appropriate, we will fully cooperate. You let us know. And that's going to be the case. But right now, we're not aware of what they're doing other than what we read in the media. And that's the way it should be. If you talk to any prosecutor or investigator, they don't want the NFL out there, quite frankly, mucking in their case. And the NFL recognizes that. The NFL investigators are former prosecutors. They understand that process. So in due time, we will be interfacing with the NFL, but not yet.
All right, once again, listening in to the attorney representing Watson. What we're going to do is send some of our viewers off into a quick 2-minute break. We'll have more news coming your way right here on Live Now from Fox. Welcome back here to Live Now from Fox. We're taking a live look in Washington, D.C., as we do have 113 veterans all joining together for a ceremony at the World War II Memorial. They are all celebrating and marking the Honor Flight Network resuming travel. You can see here we do have those veterans all lined up, and as soon as this ceremony kicks off, it will be an event we're going to jump out to here on Live Now from Fox. But until that time, we do have quite a few other live events that are taking place. I'm going to jump down to Florida because Governor DeSantis is speaking right now, and you can expect that if he does get some media questions, there may be some about those outbreaks of COVID-19 cases in his school districts, especially as the Hillsborough School District is doing that emergency board meeting with over 10,000 students who have been quarantined due to COVID-19. So once again, going to head down to Florida, then we'll have more events coming throughout this morning.
Public awareness has been lagging. We're doing a good job. I think more people are now asking about it. And now you're going to have in most of the major communities throughout Florida, hopefully by the end of the week, you're going to have the ability to go in and to do over 300 patients a day. That's a really, really big deal. So we're proud of what the Division of Emergency Management's been able to do. We had been talking with hospital CEOs. We did a roundtable a few weeks ago. They were talking about the positive effects of this. They also told me that some of the patients being admitted didn't know about it or weren't seeking it. And so then we did a public event at Tampa General to talk about the success they've had. And then we said, you know what, let's just expand this, because if we can end up doing some of these treatments through these sites, that's going to take pressure off the hospital admissions. And I know the hospitals are doing this as well, but they've obviously been dealing with a lot this summer. So wouldn't that make sense? And I think we've gotten a great response, and so we're going to continue to do it. So I want to thank DEM for what they've done. And again, this will be 7 days a week here at C.B. Smith Park. There'll be an announcement in Miami. There'll be one, Tropicana, opening later this week. And that will be something I think will be very beneficial. And the Miami hospitals have done a good job of applying this treatment as well. This supplements those efforts, which we're happy to do. Okay, so we're going to hear from Kevin, and then we'll hear from Ken.
Well, Governor, once again, thank you for your leadership on this. What is the Florida Division of Emergency Management doing? We are working with local city and county emergency management agencies to identify low or no cost solutions to bring contract staff in to apply the monoclonal antibody. So that's what the Florida Division of Emergency Management is doing, and we're bridging that gap, making sure that we can keep low, no-cost solutions on the table. So again, we want to thank Broward County, we want to thank the city, Pembroke Pines, for letting us be here. We're trying to do these in neutral locations so that many hospitals can be serviced by one location. The other thing that I would just want to mention is, again, the governor just said you don't necessarily have to have a referral here. PatientPortalFL.com is where people in this community and across the state can go and register to get an appointment to come here to this facility or any of our other 15 to 20 facilities and get the much needed Regeneron that they need. Again, PatientPortalFL.com. Again, Governor, thank you very much for your leadership on this.
Okay, Doctor.
Thank you, Governor. I just want to quickly share a story. As the Governor mentioned, we're starting to get a number of stories of the success of this program. I really thank the Governor for really expanding this life-saving therapy. So we had a gentleman, 98 years old, a really fascinating guy, really admiring of him. 98 years old, served in World War II. His family tells me he worked on the Doolittle airplane. He worked with the Tuskegee Airmen, did everything right, got fully vaccinated, but unfortunately needed to get hip surgery. And after hip surgery, he was in getting rehab, and unfortunately came down with COVID. Now his family is really well informed, and they learned about this monoclonal antibody therapy that could help save their dad, but they were having trouble getting it. They had trouble because he had surgery, it's hard to move him, transport's an issue, so they reached out to the governor's office. And within 24 hours, we were able to get, thanks to the governor, one of these strike teams to him, treated him with this life-saving therapy, and at that same facility, treated several other folks with this life-saving therapy. So I just want to briefly talk about vaccines and monoclonal antibody to clear up some of the misconceptions out there. The vaccines are preventative. They're clearly one of the best tools we have in medicine to give you long-term protection against severe illness and death from COVID. And the vaccines have been widely available for all eligible Floridians, for anyone who's wanted for months now. And if you're not already vaccinated, certainly I encourage you to go get the vaccine to get that prevention. But once you become sick, either because you're not vaccinated and you get sick, or because, like this gentleman, you're elderly and the vaccine's starting to wear off on you, you get sick, we need treatment now. Not just prevention, treatment. And that's where the monoclonal antibodies come in. So we want both. We want the vaccines to prevent you from getting severe illness, but if you get sick, we want the monoclonal antibodies to keep you from getting really sick, dying, or ending up in our hospital. Thank you very much.
And also, to point out, so there was the Eli Lilly that was also approved. We're doing Regeneron. The Regeneron is found to be effective against Delta, the Lilly not so much, and so I think most physicians with Delta being the dominant strain are going to be recommending the Regeneron, and so that's what we're bringing down. I also just want to say that so much of what goes on, well, with almost everything, but certainly with COVID, there's always people trying to push political agendas, partisan narratives, regardless of facts, trying to gaslight people, trying to pursue their own interests, even if it's not going to be helpful for people, even if it may dissuade someone from seeking a life-saving treatment. And this is no place for those phony narratives, for political posturing, or for partisanship. This has been available for a long time. It's a widely recognized treatment for people that have early-stage COVID-19. Again, the state of Florida isn't paying for this. The patients aren't paying for this. This is something that the federal government bought out very early on, and it's available and it's effective. It's not mutually exclusive for doing other things. But the fact of the matter is, if you have high prevalence and you have people who are coming down with COVID, what are their options? And this early treatment is the best option. And even a lot of people, who are trying to, play politics with this have previously acknowledged that this is something that's very effective. So let's just get real here, and let's be honest about facts. and let's not try to pursue partisan agendas that may have the effect of dissuading somebody from seeking a treatment that could potentially not only keep them out of the hospital, but could actually save their lives. With that, I'll take a couple questions. I don't think that's what they said. I think you're mischaracterizing that. I don't agree at all. They enumerated some things that would be very appropriate. And here's the thing: the forcing young kids to wear masks all day, these kindergartners, having the government to force that. That's not defying me. That's defying the state of Florida's laws and the Parents' Bill of Rights that was enacted just this past legislative session that I signed into law. That was the legislature of Florida that said the parents are the ones that have ultimate responsibility for health, education, and welfare. And so this is not just something we're making up. This is what the state law says. These emergency orders implement the law that the legislature passed. And I can tell you, I know that there's a lot of members of the legislature who say, wait a minute, you're just above the law? You think you can do whatever you want? That's not the way it is. So the legislature has spoken. I've signed it into law. Parents obviously are in the driver's seat here, and that's what the law is. There will obviously be consequences, I think, in probably a number of different ways. And at the end of the day, you have local officials who do not believe they need to follow the law. That's what this is about. It's not about, they're trying to posture it about me, because if you make it about me, you get on CNN. We know that, right? Or you get some of the other media outlets. They'll like you if you do that. We know that. That's just how the game is played. But that's not really what it's about. It's about the people of Florida, through their legislature, have said parents have certain rights. And I can tell you this, a parent has the right to send their kid to school in the way that's most healthy for their child. And to have a 5-year-old or a 6-year-old forced to do this, again, Britain doesn't have kids in mass. In fact, during their Delta wave, they didn't have the school kids in mass. European countries overwhelmingly have rejected that. In Florida, we had 35 to 40% of our school districts last year did not require this. We had charter schools, private schools. Elsewhere in the United States, you don't see a difference statistically significance in outcome on that. So therefore, it's really up to the parent, and that's not because I say so, that's because that's what Florida law commands. Yes, ma'am.
All right, Governor Ron DeSantis answering a lot of questions here. What we're going to do is send some of our folks off into a quick 2-minute commercial break. More to come here on Live Now from Fox when you return. All right, and for our folks not in that 2-minute break, we're going to continue listening in as Governor Ron DeSantis does answer questions from the media.
For people to be able to get the vaccination. So I would encourage you to go rewind the tape and watch what had happened over those times and how relentless we were about saying seniors first. Everybody's going to be able to get it. And sure enough, as Dr. Shepke said, since April, every single adult Floridian has had easy access to this. This has been distributed far and wide. You've been able to do it. But as Dr. Shepke said, it's not an either or, but if you're facing infection, which many Floridians have with this Delta wave, then what do you do? And I think the data is very clear. The vaccines are helping to prevent severe illness amongst people who do it. But once you're infected, the vaccine is not going to treat the infection. And so what do you need to do to be able to do that? So it's obviously both. But when you look at having almost 4 million seniors vaccinated, and we're #1 in the Southeast in our region, and we're ahead of the national average on that, we're not doing mandates because, quite frankly, I don't know individuals' health. It's their decision. And I remember going to that when we went to the first nursing home. We went there, and it was very emotional for a lot of the residents because They had had a rough 9 months with how fragile nursing homes were, and obviously the residents were very high risk. You had some that were crying and they were so happy, but you know what? There were some residents who just did not want to take it. And so who am I to say an 85-year-old, I don't know their health conditions, I don't know what's bringing them that. They may have had a prior COVID infection. And so there was never a
It does look like we had a little trouble, a signal pausing Governor Ron DeSantis, but again, he was answering media questions, talking about COVID-19, masks in schools. Again, one of his very own school districts, it's the 7th largest school district in the U.S., is currently having that board meeting, talking about how their staff members and students have been quarantined because of COVID-19. But what we're going to do is take a step away from Florida. We're going to actually head out to California because we do have officials talking about the wildfire season, ways that they're going to try to continue to combat these that are continuing to rage across the state. We're going to be listening in right here on Live Now from Fox.
Experiencing losses of resources. We've had a lot of structural loss, but I'm happy to report so far we have had no deaths, and that is really a very, very important point. The state's going to continue to use every available resource that we have to protect lives and property, and will remain a partner with our local government long after the fires are out. There's still a lot of work that lies ahead. The challenge we're facing is very significant, and you'll learn in a few minutes from briefings from my colleagues at CAL FIRE and the Forest Service on more details and specifics about the fires. But it's important for all Californians to understand that the severity of how our climate-driven conditions are altering the environment and are making these fires move faster and make them more complex and ultimately more dangerous than anything that we faced in the past. We're seeing very gusty winds and are seeing it combined with dry conditions and record drought, making this for a very, very dangerous and severe situation. Right now, we are in a very dynamic and challenging firefight happening concurrently in multiple corners of Northern California, from Siskiyou County all the way down to El Dorado County, and even a new fire in Upper Tulare County. To date, the governor has proclaimed 11 counties under states of emergencies and has secured fire management assistance grants for the counties of El Dorado, Lassen, Plumas, Siskiyou, Trinity, Nevada, and Placer from the Federal Emergency Management Agency. These federal fire management assistance grants enable local, state, and tribal agencies involved in the response to get funds that are necessary to ensure that they've got ongoing support for those fires and get reimbursed for the firefighting costs. Still, even with all of that, the human impact of these fires is significant. There are currently roughly 31,000 Californians under evacuation of some sort. 500 individuals are currently being housed in shelters, and we're using every tool at our disposal to meet the needs of these folks and the challenge overall. Currently, there are over 10,000 personnel working on these fires from state, local, and federal agencies, as well as 766 engines, 172 hand crews, 272 bulldozers, 296 water tenders, and 48 helicopters. Plus, our mutual aid system, which is really unparalleled among states, is currently working hard, but is stretched. We've deployed many resources from that system, including going out to other states, and we were able to get some resources from Utah to come in to support this. But even at that, there are fires, major fires in the 12 western states, and so resources are really running thin throughout the western United States. And so even getting EMAC, or assistance grant, compact resources has been limited. I do want to thank all of our local government responders, our local government fire agencies through the mutual aid system, our city councils, our city managers, our mayors, and our county executives that are supporting the system. Without that support, we could not have the kind of resources in support from the fire service that we are getting. So this has truly been a one team, one fight approach across all of government. We've also worked with our colleagues in other states. As I mentioned, beyond the Utah folks, we have resources from Wisconsin and Louisiana and West Virginia, National Guard. And General Baldwin from the National Guard is here today. We'll talk a little bit more about that, but the National Guard has been a great supporter of this effort across these various states. And even with the fire still burning, we also are moving into recovery where we can, trying to concurrently balance the response with the recovery. And we've already initiated hazardous materials teams to go in to remove household hazardous waste and other hazardous materials in the multiple counties where fires have occurred as the first stage of returning the damaged properties to their owners. This will ultimately evolve into debris clearance operations as the fire incident managers allow that to happen. And we also have doing damage assessments on the ground to document the extent of losses so that we can maximize our request for federal aid, which we're working on a request to the president for the governor to request to the president a major disaster declaration. If you've been evacuated, it's important to know, or if you've lost your home, it's also important to know that you follow your local county updates for how to apply for aid. There are local assistance centers that are being established, but you can also go online at their websites of your local county Office of Emergency Services, or you can come to Cal OES's, this agency's website and get information on the wildfires. Those local assistance centers, as they get put up, are important because they will have a number of state and local and federal agencies and private sector to provide you information on how you can navigate through what is truly a challenging time. Cal OES remains a quick partner with all of our fire victims and survivors, and will be with you throughout the days and months to come. In closing, let me just say that I want all Californians to really think through being prepared, to being vigilant over the circumstances that we are facing. We are not out of the woods by any stretch of the imagination with regards to these fire conditions. In fact, we're just beginning in the fire season, and we're already in very, very critical conditions. If you are told, if a fire starts in your area, you are told to evacuate, please do not wait, evacuate. That's what we want you to do. It's critical. Remember, material items can be replaced, but your life cannot. The other thing is that we've been working on with sheriffs and law enforcement to do preemptive evacuations in some cases where we know the fire is coming, and you may say, well, you know, the fire's right not next to me, and that's purposeful. One, it clears out the area and makes sure that the firefighters have access to your area, but it also makes sure that they don't have to be worrying about rescue instead of doing firefighting, and it does protect you. And I think that's a testament of why we have not actually had a lot of life loss in this particular fire siege, is that this is a new strategy, and we want to try to keep people out of harm's way. And so I can't thank enough our law enforcement mutual aid, the Highway Patrol, our sheriffs who have been really steadfast in making sure this has all come together, and we'll learn a little bit about that further today from our partners at the CHP. So each county has alerts systems. You can sign up for getting alerts about evacuations and fire information. You certainly can go to CAL FIRE's website and get that, and you can come to Cal OES's website and be able to click on a link to be able to sign up for alerts in your respective county. So with that, I'm going to turn it over to my partner. And
all right, guys, we're going to continue to listen into this update, especially as they do have multiple wildfires across the state continuing to burn through California. Some of you first, though, going to see a quick 2-minute commercial break.
Thank you, Director Ghilarducci, and thank you all for being here. This is a a particularly difficult time, and one where all of the mutual aid system is being stretched. The response, the law enforcement, everything is really stretched. And I can't thank you all enough, those who are supporting, your communities that are sending fire engines and law enforcement officers and overhead. We really need it, and it's making a difference in this firefight that we're in, this siege that we're in. Reflecting just for a moment on last year. Last year at this time, we were deploying teams all over California to lightning fires that had occurred and turned into complexes, and ultimately became the biggest and most acres ever burned in California's history that we have been tracking. This year, we're on track to do just the same. We're ahead of acres burned to date at this point. We continue to have initial attack fires, 34 just in the last 24 hours. None of those have become large and damaging. So we're continuing to meet our initial attack goals and needs within and around communities, but also feeding the fires that need resources and making sure that we're keeping those fires as best we can from continuing to damage and destroy communities and infrastructure along the way. So the biggest fire in states in the state right now is the Dixie Fire. Dixie Fire is the first fire that we're aware of that has burned from the west side of the mountain range all the way over and to the valley floor on the east side of the mountain range. We don't have any record of that happening before. The fire has been burning for approximately 35 days. It is exceedingly resistant to control. While we've had some successes and we've had some lines that we've held and made good progress on, when the winds come, we're finding that fires are spotting in some cases miles outside of that fire because of the sheer magnitude of the material that's burning and the heat that's being produced, carrying large embers, chunks of wood, dropping them way out in front of the fire in receptive fuel beds. So this is not going to end anytime soon. We have to all be vigilant. We need to know when new fires are starting. Call 911. Make sure that you're reporting those fires. Make sure that you're being vigilant not to start fires by your own activities. But then, lo and behold, while this is the second largest fire in California's history now, the Dixie, and the 14th most damaging fire in California's history, now we have the Caldor Fire. Caldor Fire is in a very, very difficult spot. We've seen the King Fire burn nearly in the same area. We have identified this decades ago and continue to work through what is called the Fire Adapted 50 program, which is a fuel reduction program, series of fuel breaks, shaded fuel breaks, fuel reduction project work, prescribed burns. All of that is being tested as we speak. That work is going to make a difference, but it also points to what we need to be doing more of in the future. And in the case that I mentioned, when fire is jumping outside of its perimeter, sometimes miles, sometimes those fuel projects won't stop a fire. Sometimes they're just used to slow it enough to get people out of the way, which brings me to people out of the way. Getting people out of the way of these fires is the best way for us to be able to protect your communities. We need you to evacuate. We need you to evacuate early. Everybody is going to be sucking smoke for a long time. The fire is going to come and go the way the fire is going to come and go. These are fuels-driven fires as much as weather-driven fires, and the drought conditions are allowing for that fuel condition to take fire wherever there's a receptive path that it's going to go. So please heed the warnings, and then when you're asked to get out, because we need you out of the way so we can protect your homes from these fires. It's the only way we can do it. If you're in our way in doing that, it might not only be your home that's lost, but it might be your neighbors as well. So, further, big picture from the CAL FIRE resources side. We have every CAL FIRE employee fully engaged in this siege, from Southern California all the way to the northern border. Everybody is supplying resources or supporting in some way. We have 6 all-hazard Type 1 incident management teams. Of the 6 that we have in the state, 3 of them are deployed as we speak. 1 of them is on hardcover. That leaves 2 additional in the back pocket if we have a need for them. Right now, we're hoping that won't be the case because, as I said, everybody's already working. We'll have to move some things around. But we have those 6 teams that are available, and they are proving very critical again this year in helping bring calm to these chaotic situations. Not only are the resources stretched, but they're being used in a very strategic and surgical way. The unfortunate thing is that these fires continue to get bigger, but we're surging resources into communities to protect and reduce the impact to communities as best we can and save as much as we can. And in some cases that has been effective in keeping fire out of places like Chester. We surged resources. We herded the fire around Chester. 110,000 acres of timberland burned during one burning cycle on that fire. It did not burn Chester. But there's a side problem with all of this fire that's going on in the landscape. It is happening in California's timber basket. And I say that very specifically because California's timber basket is a huge part of California's climate initiative and carbon sequestration goals in the future. We are seeing generational destruction of forests because of what these fires are doing. This is going to take a long time to come back from. And our timber industry partners are feeling a very, very big pinch during this. They're seeing their investment and their good work in sequestering carbon going away. So long-term effects, short-term, we need to surge resources, protect communities, yes, but we also have to put these fires out. In order to put these fires out, we need to keep from having more fires. So vigilance, vigilance, vigilance for every Californian. Also know every acre in California can and will burn someday. Just make sure that you're ready when it does. With that, I'm going to pass the mic to Tony Scardina, who is the Deputy Regional Forester for U.S. Forest Service Region 5 here in California. Tony?
And as we continue to listen to officials on the devastating wildfires that continue to rage through California, we are going to send some of our viewers off into a quick 2-minute break. We'll be back in that press conference when you return.
Tony?
Good morning. Thanks, Tom. First, let me start by just saying that to Californians, we know you're going through a lot right now. Communities have been impacted, a lot of smoke in the air, and our hearts, our thoughts are with you. We are doing everything between federal, state, and local government to do everything we can to suppress these fires. I'm going to give you a little bit of the national update for the Forest Service and then bring that down to California. Right now, when you look in the West, there's extreme drought across most of the western states, which is indicative of the type of fire behavior that we're seeing. Right now, there's over 100 large active fires across most of the western states, and the Forest Service and the federal agencies are preparedness level 5, which is the highest of our preparedness levels out of 1 through 5. meaning that resources are stretched, there's large fire activity across most of the range, and there's drought conditions leading to extreme fire behavior. In Northern California, we are also at preparedness level 5 due to the amount of large fire activity. We have 7 large fires across Northern California that we're currently managing, many that we're managing with local government as well as in concert with CAL FIRE. In Southern California, we're at preparedness level 3. There's been some moisture conditions, but that will only last so long. As we get into September and October, we expect to see drying out in the southern part of California and fire activity to pick up. Nationally, there are 10,000 federal firefighters deployed. 6,500 of those are in California. So 65% of the resources that we have federally are within the state of California, despite all of that activity across the other western states, again, indicative of the type of fire behavior that we're experiencing. So what's our strategy? We continue to maintain our resources across the state so that we have effective initial attack capability. One thing that we want to do is to continue to suppress new fires so we don't add new fires to the landscape. Our success in that has been 98%. So we'll continue to stay aggressive. On-the-ground resources as well as aircraft are critical to that strategy. The other piece that we're doing is that we are going to do everything we can to fully suppress large fires and keep them as small as we can. As Tom mentioned, with the extreme fire behavior, that is difficult to do. We're going to continue to put as much aircraft and resources on the ground as we can, but keeping fire small at this point is quite difficult. And then we're going to prioritize our resources around protecting life, getting people out safely, protecting property, including the timberlands that Tom talked about, and then other resources after that. So that's how we prioritize our aircraft and our on-the-ground resources. The other thing that we're doing in the state right now is we have large closure areas around fires. The importance of that is to keep the public safe. We're also looking at the potential for broader closures across Northern California until the situation abates. We're able to get more resources into the state, and that is to keep the public safe, keep fires off the landscape, and keep our firefighters sustained over a long period of time. Our folks have been fighting fire for nearly 2 months now. They're tired, they're fatigued, they're digging lines 16 hours a day for 14 days straight, and we're doing everything we can for their health and safety as well. And again, I want to thank the communities out there that have been impacted. They're going through a lot. We're all going to work together here to help them through that and get through that recovery process. With that, I'm going to hand it over to General Baldwin with CalGuard. Thank you.
Thanks, Tony, and good morning, everybody. The CalGuard has 970 soldiers, airmen, and sailors supporting firefighting efforts throughout the state. That includes 122 military members from the states that Director Ghilarducci mentioned, plus the state of Nevada and Wyoming's National Guard and the United States Air Force Reserve. We're flying 20 different types of aircraft in support of fire suppression operations. That includes firefighting helicopters, firefighting air tankers, medical evacuation helicopters, and manned and unmanned situational awareness aircraft that are assisting with fire mapping and damage assessment. We're also using our space-based systems to do initial fire detections to help CAL FIRE and U.S. Forest Service pounce on fires when they break out, and we can also use those systems for fire mapping and damage assessment. On the ground, we have 25 hand crews that are organized as both Type 1 and Type 2 hand crews that are supporting firefighting efforts, mainly on the Dixie Fire. We also have 72 military policemen that are working in support of our partners in the Highway Patrol and the Plumas County Sheriff's Department, manning traffic control points to keep people out of harm's way up on the Dixie Fire. And then finally, we've just mobilized 3 very large fuel tankers to provide logistic support to CAL FIRE up in Redding. And I'll be followed by Chief Mike Dust from the California Highway Patrol.
Thank you, General. Once again, I'm Mike Dust. I'm from CHP. I'm the Chief over Valley Division. And first and foremost, on behalf of Commissioner Ray, our hearts go out to all those affected by these fires, not only locally but statewide. And I also want to thank all the first responders who are also affected by these fires through evacuations and some of them losing their homes, and yet they still come to work to serve these communities. To that end, the California Highway Patrol statewide is providing assistance to local sheriffs, to fire services in support of traffic control points and evacuations. It's been said earlier about the need to get out during warnings. There is a difference between a warning and an order. When warnings occur, traffic trickles out of those communities. When an order happens, that turns into traffic jams, and it becomes very difficult then for people to escape. The CHP mans those traffic control points for the safety of the community. And one thing that we've noticed during all of these fires is once the fire is out of view, you might still see a CHP car sitting there. And the officer there gets asked questions, and we don't mind answering any questions that you have, but some of those questions are, why can't I go? Why can't I go? There's no fire here. Why can't I go up to where my house is? And the reason is because there could be something around the corner that you don't know about. There's fire apparatus, there's hoses across roads, there's downed power lines and power poles, there's downed trees, contaminated water. There's all kinds of things that need to be mitigated and restored before we can open those roads. So we just ask for your patience for our folks during those. And thank you once again. And Director Gilladucci, I'll turn it back to you.
Thank you, Chief. All right, so as you can see, there's, this state effort being coordinated statewide here at the State Operations Center, all these agencies, local, state, and federal, and private coming together in this coordinated effort to respond to these fires. Again, we're early in the season. I think we're going to have a very, very challenging summer months that as it continues to be warm and dry, and we are in drought conditions. So we just ask for everyone's cooperation, patience, and this isn't really just a government solution. This is a whole of community solution. So every citizen in California is a partner with us in this, and your preparedness level and your actions really do matter in this whole thing. So we thank you all for your cooperation with that. With that, this team will be happy to answer any questions. Yes, sir.
All right. Once again, getting that update with officials out in California as they continue to try to battle a number of wildfires that are spreading across the state. I'm going to send some of our folks off into a quick 2-minute break. We're going to be switching gears, talking about Afghanistan with a decorated veteran who had been both to Iraq and Afghanistan. We'll have more on that again after a quick 2-minute commercial break. And welcome back to all of our viewers here with us on Live Now from Fox. We want to continue bringing you news stories happening across the country. We're going to jump into a Zoom meeting with Representative Green, who was also a person who was deployed back in Iraq and Afghanistan. He's discussing, though, the combating Chinese influence in the Western Hemisphere. We're going to jump into it live here for all of our folks with us on Live Now from Fox.
About transnational organized crime, or real problems, narcotics trafficking and so forth, and so when China comes, they're talking about investment. They're coming with duffel bags full of cash, and they said we wish we could have more conversations with our American friends about opportunities. So what I'd like to do is, you alluded to this a little bit already. There's a big competition, I think, going on across the hemisphere, right? You have the López Obrador government in Mexico that is trying out hugs, not bullets, with narcotics traffickers, not working out really well. He has a philosophy that is not very business and free market friendly. You have Ortega doubling down on his authoritarian regime in Nicaragua. Yeah, he's still kicking around there. You have a strange kind of cult of personality in El Salvador. You had recent big protests in Costa Rica, right, because of the cutting of government subsidies. You have an election coming up in Colombia against the backdrop of major protests and popular discontent there. You mentioned the outcome of, just elected a Marxist, in Peru. You have a constitutional rewrite going on in Chile. Yeah. Bolsonaro's it seems like he's got less and less of a grip on power. Yeah. Argentina's already moved left in the last election. Okay, it looks to me like we're losing ground, but there's some bright spots, right? Okay, you could say Ecuador, Bolivia moved in a better direction. So, would you mind, as we transition into the questions from our audience here, and I've got one more for you as well at the end. Before, as we transition, what's your overall assessment of the trends in the hemisphere, and what more can we do about trying to foster, a better future for generations of Americans, and I mean South Americans, Central Americans, North Americans to come?
Well, I am concerned about this. Malign influence of China. I am very much concerned about how that's impacting the metastasis of what Maduro is doing in Venezuela throughout the both Central and South America, and so the fact that Peru voted in a Marxist, much like Venezuela did, with Chavez, that's very concerning. What Ortega's doing is very concerning. So overall, there's this trend toward authoritarianism. Much of the issues in Colombia are exported from Venezuela, and not just by the refugees that have fled from Venezuela, but by malign activity from, Venezuela propping up some of the other organizations, as well as narco-terrorism.
Right. And then you could trace that back to Cuba, right, who supported that as well.
Right.
Yeah, right, yeah.
And that was, I was going to comment about bright spots. There are bright spots. One major bright spot is the recent, I don't want to call it uprising, but sentiment and protests that have been going on in Cuba. There's a real hope there that this generation is going to stand up to the totalitarianism of the, I still call it the Castro regime, but it is essentially a continuation of it. So I think with the images of that, you take that to the rest of Latin America and say, look, no one wants what Cuba is exporting. Maybe we have a chance. What we need is on our side, particularly from our president, to recognize what's going on in Cuba and support what's happening.
Well, and I think what's great about this bill is it addresses some of the economic incentives that could maybe help grow economies and hopefully address kind of the grave concerns about income disparity, inequality of income that are also, I think, providing, fertile ground, for those who want to advance kind of leftist and statist economic ideologies and so forth. Some of the critics, though, this is the institution of Milton Friedman. So I've got to ask you this, Mark. Some critics are worried about the erosion of market incentives with this. They're wary. Some people are wary of the DFC. They're worried that what if we don't prioritize countries with sound economic and fiscal policies and we waste our efforts. Some are concerned about tariffs, right? Tariffs on I know tariffs on Chinese products are meant to pay for a lot of the of this bill. And then some are even concerned that there might be like a bidding war, right, between China and the U.S. with these kind of incentives, and then you have U.S. taxpayers trying to up the ante, right, against Chinese national banks, for example. So I know you've heard these criticisms, and that you and your staff have been open to them because you want to anticipate them and address them in the bill. Could you just say a few words about those that are wary about really anything that looks like, industrial policy or something that could distort free market incentives?
Yeah, I think there are very few folks who are more free market than I am. You can look at my voting record, and you can look at my voting record as a Tennessee state senator and the bills that I supported there. At the same time, I'm also a national security guy. I'm on armed services and I'm on foreign affairs, because the security of America is probably my greatest concern. Warfare is no longer 100% kinetic. I mean, what's happening in Ukraine, what China is doing to take allies from us. I love the paradigm, the dying paradigm, diplomatic, informational, military, and economic warfare. If you look at China, what it did to Motorola when it went into China, they basically stole their secrets, developed Huawei, and put Motorola, a U.S. company, out of business, costing thousands of jobs, billions off of our gross domestic product, which fuels our ability to take care of ourselves and our military. So we're engaged in, we'll call it competition, but it is desperate. It is critical. And it's going to require us to be as innovative as we possibly can in the markets in order to compete. And so the Development Finance Corp, I like it because it's private dollars. Now, granted, we have the tariffs with China, and I've never been a fan of tariffs, but I am for fair trade, and I'm not sure China's been cooperative there. So as long as the tariffs are in place, let's use that money to incentivize folks to move from China, decrease our dependency on them, take back the allies that we have in Latin America, create opportunity, and help our national security issue at our southern border. So I see it as a national security thing. I'm trying to use conservative mechanisms to do it, and I understand that there'll be a few people that are concerned about that. But I want the feedback. We are sending the bill to all of the conservative think tanks and free market folks and getting their input. We'll make changes. We haven't dropped the bill yet because we expect that feedback to make it a better bill.
Right. And I know that the phrase that Bob Lighthizer would always use is reciprocal, free, fair, and reciprocal. And
that's good.
And then he would emphasize, the need to employ, trade enforcement mechanisms to get back, to reciprocal trade arrangements. Hey, there's a question on Panama where I just last talked to you from, and Panama is a small country in terms of population, but man, it can punch above its weight. It's a connector to the world, and so Edgardo is asking a question about Panama being historically important, obviously, to the U.S. and the Western Hemisphere, and China knows that too. And so, what do you recommend on Panama in particular? What more could we do to compete effectively there, and to continue to strengthen? It was already kind of a strong relationship economically and diplomatically with Panama.
There's a lot of things that we can do. Of course, this bill that we've talked about during the show would of course apply to Panama. That country would clearly qualify for those nearshoring companies. HR, you mentioned it at the very beginning. We don't have an ambassador. I mean, just basic diplomatic relationships need to be improved, because friendships are about. I mean, my relationship with my wife, if I don't get time with her, the relationship needs work. So we've got to address that piece of it. And I think militarily, we need to do a lot more joint stuff militarily with our Latin American partners, and Panama is probably one of the best partners in that regard. So we removed a lot of our forces from there, removed our Southern Command and all that stuff, but just continuing those relationships would be very important.
Hey, we're getting a number of questions about how we compete more effectively, you know, in the commercial space, in the private sector. Paul's asking about what are we doing to battle Chinese influence, you know, in the corporate world, right? We've seen the coercion of, you know, the NBA and Marriott and Nike and others, and there are questions, related questions about, you know, ESG, right? The environmental social governance issues. Why isn't China like an ESG issue? And then Bodie, who I think might be close to you there in Tennessee, has asked, you know, what do you see in Tennessee in terms of Chinese influence, and what is the degree to which, you know, we're talking about obviously Chinese influence in our hemisphere and in Latin America in particular, but what do you see operating in terms of Chinese influence in the U.S.? So some related questions from Bodie and Paul about influence in the corporate world and in the United States in particular.
So let me address the Tennessee piece of that first. Tennessee had, like many states, put an economic development office in, I think it was in Shanghai. We may have had 2 different cities. And our current governor, you know, debated about whether or not to close that and whether or not we push to bring Chinese companies to Tennessee. We talked to him, Mike Pompeo, my West Point classmate, talked to him, and Governor Lee decided to close those offices and not pursue, using economic development dollars from Tennessee to recruit Chinese businesses. And it's really all because of their security acts, which require data from Chinese companies to be shared with the Communist Party. So in Tennessee, I think we're taking a good path. Other bills that are out there right now that are attempting to address this, Chip Roy has a great bill about land purchases by the Chinese, large Chinese companies, especially state-owned enterprises. There was an issue with a wind farm down there connecting to the power grid, and Texans voted no and kept that from happening. But there are multiple bills on sort of that piece of it and their influence inside the United States. Internationally, or well, corporately, I think was the other part of the question. And we've got bills on intellectual property theft, cyber security, and all of those things that sort of protect our company. Our companies are really vulnerable because, you know, in the United States, we approach cyber as a private, not public responsibility. So the government is responsible for its own networks, but companies are responsible for their own. Whereas China does just the opposite. So they protect everybody with the Great Firewall of China and other tools, which, interestingly enough, are probably more directed toward their own citizens. But there are several bills that are trying to address that. What we need is people to communicate with both sides of the aisle the urgency to get some of these bills passed. And with help from the people of our country pushing, particularly the opposite side of the aisle to me, we can hopefully get some of these bills passed. If you go and look at the China Task Force report from the last Congress, there's a list of probably a couple of hundred bills that need to happen to, particularly the malign stuff like IP theft and cyber from China.
So we had these questions now about influence in the U.S. as well, and now there's a broader question to take us out of our own hemisphere, but to look globally. And you know, John has pointed out that there's a naval base in Djibouti, you know, for example, around the corner from our camp there, Camp Lemonnier. And so what he's asking is overall, what's your assessment of the strategic implications of their presence there? But I would also ask you maybe to place into context what China's doing in Latin America, what they're doing in Djibouti on the south side of the Bab el-Mandeb, and in a broader context of what they're trying to achieve in connection with global logistics networks and communications networks globally.
I think my biggest concern, and you know, there are a lot of, I mean, that's a book in and of itself, that question, but is our, you know, choke points in the seas, particularly the way they're controlling ports, some through their debt diplomacy, some through just their state-owned enterprises taking control of ports. Obviously places like the Straits of Malacca and all of these sort of choke points for trade and for shipping on the ocean, the South China Sea, that's probably my number one concern. But the commodity extraction, the manipulation, what they're doing in Africa is that's what's coming for Latin America. So if you look at what they've done in Africa, that is the same model that they're using in Latin America, and that is debt diplomacy, building infrastructure projects that fail, and then, like Ecuador, require a huge portion of their commodities to offset the inability to pay for those loans. So what happened in Africa is happening in Latin America. But again, I think the bigger concern is more the ports and the control of shipping.
Just to give you a heads up, we're getting a lot of questions on Taiwan, but first, what I'd like to do is ask you about the hemisphere again. And of course, what we're doing now has to be placed in historical context. And Ken is asking a question about our long and complicated history of interventions in South and Central America. How do we build trust? And then he's asked the related question, the obvious one, that China's coming into these regions without that baggage, a clean slate, right? How do you see us competing with China really on the the informational, psychological, emotional battleground, so to speak, with China?
So I would submit that most Latin American countries are pretty wide-eyed about what China does. There have been plenty of examples in the region, but there are also many, many examples, in Africa. So when I talk to ambassadors, and I had dinner with the ambassador of Argentina just recently, I'll be in Brazil in a week. All of these guys know what China is doing, and they're doing their best to mitigate it. Also, and someone asked, I think in a previous question, about the environmental damage that China is causing in Latin America with its infrastructure projects.
All right, guys, what we're going to do is send some of our folks off into a quick 2-minute break. When we return, State Department briefing just underway. We're going to be headed out to that when you come back.
Programming. So without further ado, Deputy Secretary.
Thank you very much. Good afternoon. I want to update all on the situation on the ground in Afghanistan. The State Department, I can tell you from personal experience, has been working around the clock to respond to an enormously challenging and fluid situation. This is absolutely an all-hands-on-deck effort to ensure the safety of our personnel and citizens, rally our allies and partners, and organize the evacuation of thousands and thousands of Afghans. In the last 24 hours, U.S. military flights evacuated approximately 2,000 more people. Over the last several days, we have processed more than 4,840 people for evacuation. We have communicated directly with all U.S. citizens who enrolled with Embassy Kabul with specific instructions about when and where to go for evacuation flights. Shortly, we will invite more than 800 Afghan special immigrant visa holders to board flights to the United States. We are beginning to expand our notifications and are expanding them to transmit information about evacuation options to each group. We will also continue to accelerate our efforts, including by working with our allies and partners, NGOs to identify and assist Afghans eligible for P1 or P2 refugee status and other Afghans at risk. We are continuing to surge resources here in Washington and at our missions around the world, including in Kabul, where our outstanding charge d'affaires and other staff remain on the ground, working tirelessly and with very little sleep, if any, to help American citizens, third country nationals, and Afghans who fear for their lives and wish to leave the country. Our former ambassador to Afghanistan, John Bass, will be on the ground in Kabul very shortly to support these efforts. He's already in the region. Major General Chris Donahue, the commander of the 82nd Airborne Division, is also on his way, if not already in Kabul, to help facilitate the evacuation. Additional consular officers arrived in Kabul today, and we will nearly double the number of consular officers on the ground by Friday. Our diplomatic and military personnel are working in lockstep toward the same goal: to get as many people who want to leave Afghanistan and who are vulnerable to Taliban reprisals because they help the United States and our allies and partners, or who are otherwise at risk because of who they are, or what they do, or what they believe, out of the country as quickly and as safely as possible. The events and images of the last week have been wrenching for all of us. I'm sure for you as well. Thousands of State Department personnel have served in Afghanistan over the last 2 decades, many more than once. An entire generation of diplomats were called to join the Foreign Service after the September 11th attacks. And even those of us who haven't served in Afghanistan ourselves know many who have. The men and women of the State Department have built deep, enduring relationships with Afghan citizens who want the same things that people everywhere want: education and economic opportunity for themselves and for their children, a free press that can speak truth to power, freedom to live without fear of violence or oppression, equality for women and girls, a good life. We will stand with those who have stood with us. From the State Department and across the federal government, we are simultaneously pursuing multiple lines of effort to respond to the situation on the ground in Afghanistan. We are in contact with our locally employed embassy staff and are offering the opportunity to evacuate with their families if they choose to do so. We are continuing to process visas for Afghans eligible for SIV status and their families. For those who are early in the process, we are working with our allies and partners to move them to third countries while their paperwork is completed. We are also urgently accelerating our efforts to assist eligible Afghans under the Priority 1 and Priority 2, P1 and P2 referrals to U.S. Refugee Admissions Program and humanitarian parole. And we are working on our own with our allies and partners and with NGOs to identify and assist other Afghans at risk, including women and girls, human rights defenders, journalists, and other civil society actors. We have seen reports that the Taliban, contrary to their public statements and their commitments to our government, are blocking Afghans who wish to leave the country from reaching the airport. Our team in Doha and our military partners on the ground in Kabul are engaging directly with the Taliban to make clear that we expect them to allow all American citizens, all third country nationals, and all Afghans who wish to leave to do so safely and without harassment. A majority of the world's nations this morning, as of this morning, 109 governments and counting, have come together to underscore the same message. The State Department is tirelessly pursuing diplomatic efforts with our allies and partners in every region of the world to mobilize resources to save Afghan lives. As you know, Secretary Blinken has spoken to more than a dozen of his counterparts in recent days, some of them multiple times. I've been doing the same. This morning, Undersecretary of State Nuland and I convened the deputy foreign ministers and political directors from more than a dozen allies. I think we had 20 on the phone, and partners to encourage everyone to take additional steps to help the Afghan people. Our ambassadors are working day and night in capitals around the world. Our undersecretaries, assistant secretaries, senior bureau officials, desk officers are doing the same. Our support staff are doing the same. As I said, this is an all-hands-on-deck effort, and we aren't going to let up. On the political front, we saw a very strong statement on Monday from the UN Security Council, including China and Russia. They reiterated the need for an inclusive, just, durable, and realistic political settlement that protects human rights, including for women, children, and minorities. President Biden and Prime Minister Boris Johnson agreed yesterday to hold a virtual G7 leaders meeting on Afghanistan next week. And earlier today, NATO Secretary General Jens Stoltenberg announced he is convening a virtual meeting of NATO foreign ministers on Friday to discuss our common approach. The United States and the international community have also been extremely clear. We remain committed to combating terrorism in Afghanistan and will not tolerate a government that allows Afghanistan to once again become a safe haven for terrorists. As President Biden said, the United States will maintain a laser focus on our counterterrorism mission in Afghanistan and in other parts of the world. And we will hold the Taliban accountable to the commitments they made in the 2020 agreement and those they have made since, that they will not allow terrorist groups that threaten the United States or its allies to operate on Afghan soil. Before I take your questions, I want to speak to a situation that's very personal to me, facing Afghan women and children. Yesterday, the Taliban held a press conference where they claimed they intend to allow women to work and study, but only within what they called their, quote, frameworks. The United States and the international community will be vigilant in monitoring how any future government in Afghanistan ensures the rights and freedoms that women and girls in that country have come to expect. The United States joined 20 other nations this morning in jointly affirming that commitment. As I said, this is personal for me, as it is for many people here at the State Department and across the federal government. In 1997, I joined then Secretary of State Albright when she visited Afghan women and girls in a refugee camp in Peshawar, Pakistan. Secretary Albright told them, quote, "It is impossible to modernize a nation if half or more of the population is left behind," unquote. That was one of the most searing meetings I have had as a diplomat. I had a teenage daughter at the time. A young teenager told me about watching her sister being raped and thrown out a window. Women who were doctors and teachers and homemakers talked about how they couldn't do and have their lives anymore. That memory will never be wiped from my mind. Societies could not flourish and prosper without the full participation of women and girls back then, and they cannot flourish and prosper without women and girls now. In the last 20 years, Afghan women and girls have embraced their freedom. Millions have gone to school. They have become doctors, lawyers, journalists, parliamentarians, and entrepreneurs. They have built the lives that Secretary Albright encouraged them to imagine all those years ago, and so much more. When I was Undersecretary for Political Affairs during the Obama administration, I traveled to Kabul and to Herat. I met with women and girls in both cities and saw the amazing things they'd accomplished, their talent, their drive, the vibrancy of the society they were working so hard to build. And I have met with Afghan women leaders in my time as Deputy Secretary of State as well, to hear from them about their tireless efforts to educate women and girls. These ambitions, these dreams, and above all the concrete progress they have made for themselves, their families, their neighbors, and their country, are all things I carry with me every single day. The United States and our allies and partners will continue to fight for Afghan women and girls, and Secretary Blinken and the President of the United States join me in that drive. We are working with the international community to help those who are vulnerable who are facing Taliban reprisals to get to safety. And we will use every economic, diplomatic, and political tool we have to hold the Taliban accountable to their words and more. With that, I'll take your questions.
Start with Nazir. Please.
First of all, thank you very much. I tried to be a good person today. I shouldn't cry. The other day I was crying at the Pentagon for sadness. Now, thank you very much for your good message for Afghan women. I'm one of them. You mentioned good things about Afghanistan. I was the journalist, escaped from the Taliban. Many Afghan, as you said. Thank you so much. On behalf of Afghan suffered women, thank you for the United States. Thank you for you Thank you for you, Mr. Price, to invite me today. I appreciate many Afghans go to the airport to leave the Afghanistan, still Taliban try to beat them. But as long as they expect from me, their expectation is very high that Nazir Karimi is somebody. They think that I can't do anything, but I'm ordinary journalist. Just I am voice for the less voiceless Afghan suffered women. And thank you so much for your opportunity. I will pass them. Of course, they know, they listen to, appreciate it. Thank you so much.
Thank you.
Thank you.
Matt.
Matt, it's been so long.
It has been so long. And I guess I can't call you Wendy anymore. I'll have to call you Madam Deputy Secretary. Even though
That sounds good.
It's a bit of a mouthful. Listen, on the...
You'll get used to it.
Yeah, I'm sure. On the immediate question, you said you're surging the number of consular officers at the airport. People are going in. Well, all of that's great, but if people can't get to the airport, and I realize you mentioned this in your the issue, if people can't get to the airport, it doesn't really matter, right? How many people you have there. So my question is, what exactly are you telling the Taliban that is going to happen to them if they don't start letting in not just Americans, LPRs, but Afghans who are at risk, and potentially even Afghans who are at risk who don't have all of the necessary paperwork that they might need to get out?
So thank you, Matt. I think we know each other well enough for you to know that I'm not going to tell you the ins and outs of the diplomacy that is going on. I will say that we are in discussions trying to ensure that there is not only safe passage for American citizens, for diplomats of third countries and third country nationals, but for everybody who is trying to get to the airport. That work is ongoing. The Taliban has said it will not have reprisals, that is established an amnesty, that the roads are open, that people can move. We have heard all of the stories that have many journalists in Afghanistan are reporting about checkpoints, about harassment, about difficulties, about jammed traffic. And so we are trying to work through those issues as best we can. I will tell you this, in spite of the obstacles, many Afghans in all of the categories that you cited are finding their way to the airport. And we will continue to do what we can through diplomacy. And you know, it's not just us. It's the international community. As I said, over 109 countries who have called on the Taliban to do this. The Taliban are hoping to create a government in Afghanistan. They seek legitimacy. We are all watching their actions. Their actions will speak to whether, in fact, they are going to protect the basic human rights and the basic rights of the Afghan people. And their actions in these days will tell us whether there's reality to what their words say or whether there is not.
Sean.
Thank you. Could I ask you, you've spent a lot of time with the Chinese, of course, in the past few months.
Lately, yes.
Could I ask you whether you think the United States and China, along with other powers, are on the same page in Afghanistan? What are the messages you're receiving from Beijing and from Moscow and other capitals, and also from Islamabad? Is there some push that you have to not recognize, for no country to recognize the Taliban right now?
Each country, of course, makes its own decisions about its national security and its foreign policy. That said, I think that the UN Security Council resolution that was passed by consensus, everybody on board earlier this week, speaks to the fact that we are all in the same place, which is calling on the Taliban to ensure justice and equal rights and inclusion, for there to be no violence, for people to be able to leave when they can. So I think right now there is very strong unanimity. As I think has been reported out, Secretary Blinken has spoken to many ministers, presidents and prime ministers. And this week he has spoken to both Foreign Minister Lavrov and Foreign Minister Wang Yi to continue our conversations to try to all head in the same direction.
Laura.
All right, guys, do you want to just let everyone know we are going to be sending some of you off into another quick 2-minute commercial break. As you can see, too, we do have another press conference that's going to be underway here. So we are still waiting for the Pentagon briefing. This is going to be with the U.S. Defense Secretary and Chairman of the Joint Chiefs of Staff. They're holding their very first press conference. They're going to be speaking on Afghanistan and the Taliban. So we'll have that coming up here in just a little bit for all of our viewers. But again, some of you first going to see a quick 2-minute commercial break. When we come back, going to continue to listen in to the State Department briefing on the situation in Afghanistan.
And that is that.
And there's no reaction? I mean, does the United States...
He is no longer a figure in Afghanistan.
How does this play into your relationship with the UAE?
We have a fine relationship with the UAE.
Okay. And the fate of the embassy past August 31st?
So I think we now have a functioning embassy out at the airport. It will continue to function as long as it possibly can, providing services to not only American citizens, but our international partners, to SIVs, to Afghans at risk. That is our mission right now, and that is what we are focused on.
Simon?
Yeah, you talked about these images that we've seen coming out of Kabul and the impact that has on diplomats and on everyone who's seeing them. I'm wondering, this also relates to your role with China, you know, the impact that this is having on US credibility around the world. We've seen, you know, Chinese outlets trying to kind of make play on this, talking about a lesson about abandonment for Taiwan. From the UK, lawmakers are saying, you know, this is a failure of intelligence, leadership, and moral duty. You know, the kind of similar criticisms to what we saw in the previous administration regarding the Syrian Kurds. You know, so it's just a repeating pattern of, you know, abandonment by the US, leaving allies, vulnerable people, and women at the mercy of notorious human rights abusers, as is happening now. So, you know, what can you say to your allies, potential future allies, and existing allies about whether the US is a reliable partner in the world after what we're seeing in Afghanistan?
I think we have said to each other, as we did on the conference call this morning that I hosted, I think we have said it to each other at the NAC meeting that was held in Brussels, I think just yesterday, and will be said again at the NAC Ministerial on Friday. I think it is what we have said to each other in the over 109 countries who have signed on to the statement we put out, I guess earlier this week. I can't even remember the days anymore since I don't go home anymore. That we all share a focus right now on making sure that our countrymen and women, that Afghans at risk in all categories are able to leave the country, should they so choose. That is our mission. We are not focused on the after-action report, which we will all be doing. We will do one here at the State Department. Our government will do one. We will assess what happened, what didn't happen. You know, as Admiral Kirby said the other day, as every good general knows, you put a plan together, and after the first step, you have to create a new plan because there are always events you didn't expect. When we put many SIVs through our system, and then our embassy was hit with COVID so that we had to lock down and stop our consular services, that couldn't have been planned for, that COVID would hit our embassy as hard as it did in Kabul. So you have to begin anew, figure out a new plan, what you can do online, or what you can do without face-to-face interviews, how fast you can get back up and running. We have done all of that. We have already, through the existing SIV program, put through 76,000 SIVs. I think since we've started this next round, I have to check my notes a minute. I think we have done more than 2,000. The SIV legislation gave these folks visas, but what this administration has done that no administration has done before is to provide the airlift out of Afghanistan to come to the United States. So I think we have picked up the ball and kept running because our focus is on getting the people who want out of Afghanistan out to safety. It is also holding the Taliban accountable as it tries to stand up a transitional government for what is expected of them. to ensure that it is a just, inclusive society.
Let's take a final question or two. Kylie?
Thank you for doing this. I'm wondering about this security alert that went out to Americans just recently. It said that the U.S. cannot ensure safe passage to the airport for those Americans. So I'm wondering what this says about the competency of this mission and also the U.S. confidence in the Taliban's commitment to provide a safe passage to the airport, that you're telling these Americans, you can go to the airport if you want, but you're not necessarily going to get there safely.
First of all, we had many Americans show up when the notice went out. All Americans have now been notified to the extent we have them on our email system. Americans are not required to register with the State Department. So the only emails we have are those Americans who signed up with our system. We've also put it on our website. We've also made public announcements, Ned has from the podium, to try to make sure American citizens know they have this option. The Taliban made a commitment to safe passage for American citizens. I don't know of, my colleagues may know of, an incident where an American got harassed or hustled or wasn't able to get to the airport. I have not heard of that yet. That's not to say there aren't any stories like that. I'm sure out there somewhere, given everything that's going on, there probably may be some. But so far, it appears Americans have been able to get to the airport. You know, Kabul, I don't know if you've ever been there, is an enormous city. Enormous. And it has, in fact, had more and more people come to Kabul because they thought it was the safest place to be in Afghanistan. So it is difficult under any circumstances, and I don't know of any government that would be capable of reaching out to where everybody might be, particularly those who have not signed up to us to help them. As I said, so far, the track record is quite good for Americans getting to HKIA, and it appears that the Taliban's commitment for safe passage for American citizens has been solid. Again, I don't know every case, so I'm not making a bottom line assessment here. But so far, the experience seems to be one that has worked.
And can I just ask you one?
Just in the interest of fairness, Connor,
Sure.
And then we've asked enough of the Deputy Secretary.
Deputy Secretary, to your point about no other administration has done this kind of airlift before. No other administration had to do this kind of airlift before. And the operation that you've begun didn't begin until late July. So far, it's only brought 2,000 Afghans through Fort Lee in Virginia. Was this a failure of the administration to prioritize this issue and to bring Afghans to security while you still had the chance before Kabul fell?
As I think you've heard it said from several podiums already, including